you so much. Thank you for your kind invitation, Rizky, and the rest of university and committee organizers.
Yes, son. Thank you so much for coming and joining.
Yeah. Sorry, I try to speak Bahasa, but my Bahasa is so weak. Yeah, I used to learn, Bahasa when I was young. I just learned to read, not learn to speak.
Ibu Ida lagi ngapain itu Ibu Ida? Apa kabar Ibu? Ya, masih di mute Bu, masih di mute. Jadi nggak kedengeran suaranya.
Oke, baik Bapak.
Salam kenal Bu Ida ya.
Assalamualaikum.
Pertama kali.
Brothers, sisters here, right?
Miss Ida Widyaningsi is also our speaker, Achan, from Pajajaran University.
Yes. That's okay. Yeah, go ahead. Do your program. Halo, Assalamualaikum.
Waalaikumsalam.
Yeah, can you hear me, sister?
Yes,
Isha, right?
you.
Yeah.
Yes.
Suaranya mana? Suaranya.
Ya, selamat pagi kepada seluruh partisipan, speakers, excellencies, ladies and gentlemen. Sebentar lagi kegiatan webinar kita akan segera dimulai. Sekitar sudah lebih dari 200 partisipan yang telah hadir. Selamat pagi sekali lagi untuk semuanya. Well, ladies and gentlemen, may I have your attention, please? Our opening ceremony is about to begin. Ya, selamat pagi kepada partisipan dari Universitas Kendari. Di sini tampak hadir dari berbagai institusi, dari berbagai provinsi. Terima kasih atas apresiasi dan partisipasinya. Selamat pagi dari Universitas Kristen Maranatha Bandung. Salam kenal kembali. Ya, Universitas Maranatha. Once again, ladies and gentlemen, our opening ceremony is about to begin.
Morning, Dr. Alex. Dr. Alex.
Goedemorgen. It's very good to see you this morning. How are you doing? How are you doing today, Mr. Adinda Rizky?
Yeah, I'm fine. Like you see,
Oh,
there is Imron Sosan, Dr. Imron Sosan, Dr. Ida is still here.
Mr. Imron Sohsan.
Ya, assalamualaikum. Ya.
Waalaikumsalam warahmatullahi
Yeah,
wabarakatuh.
Dr. Alex. Yes. I'm in New Zealand, in Auckland now.
All right.
Yeah. Quite
It's very
far from you.
In Auckland at what time right now, Mr.
Now it's 2.
2. Oh my God.
Yeah. Afternoon.
To sleep this.
Yes.
Afternoon.
Yeah, we are. You know, our in New Zealand time is earlier than there. Maybe 5 hours, maybe earlier.
Yeah. Mr. Rizky has talked about you much.
Whoa, he is my student.
Yeah. He was a student.
Yes, I'm honored, to be part of this conference, because I said to Rizky, are you sure to invite me to be there?
Yeah. So am I actually, Mr. Somsan?
Yeah. You can call me Imran.
Imran. Okay.
Yeah, Imran. Yes.
Are you alone there or with family, Mr. Imran?
Definitely, I'm alone because I left my family in Thailand.
Oh yeah.
I left my wife and my daughter. One only little one. I have just one daughter.
Okay.
Yes. They are in Thailand, not here, because my scholarship doesn't cover anything as family to be here.
Oh yes. We do pray that you can finish your education, obtain your doctoral degree soon.
Jazakumullah khairan. Terima kasih.
May invite you to teach with us here.
Oh yes, definitely. Yeah. I'm pleased. If I can join, I can participate. Whatever you say that okay. I can deliver. Please tell me.
Oh, thank you very much.
I just gave a talk to a university from Malawan. Maybe Rizky.
Okay.
Yeah. Just
Imran asked you.
My teaching, my class, PA, public administration class from University Malawan. Maybe
Malawan in.
Because I have a friend.
Sorry, I'm sorry, Mr. I'm sorry for disturbing you, because we have to get ready to start.
Okay. Go ahead, sister. Yeah. Just introduction.
Okay. Well, ladies and gentlemen, I want to review the rules of international webinar and conferences. One, access to Zoom will be unlocked 5 minutes before the event starts. 2, participant IDs in the webinar must use their real names, not device names or institutional names. Participants who have access to Zoom must dress modestly and behave politely when the webinar is held. Participants are strongly expected to mute during the webinar process. All participants who take part in the webinar via Zoom or YouTube can ask questions by type in ask, then continue by writing down the name, origin of the institution, and the question briefly. The moderator will ask the speaker some question because time for discussion is limited. Certificate will be distributed to participants who attend the event from the beginning to the end of the webinar. At the end of the event, the attendance list link will be shared. The link will only be active for 13 minutes. Participants who do not fill in the Google registration form before the event starts and or do not fill in the attendance list when the event is over will not get a certificate. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum.
We are start now. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, selamat pagi. Let me introduce myself first. My name is Efsa Ulansuri, lecturer at the Faculty of Social and Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, selamat pagi. Let me introduce myself first. My name is Efsa Ulansuri, lecturer at the Faculty of Social and Political Sciences. It's a precious chance for me to be host on this very special occasion, building the rural resilience against COVID-19's impact. First of all, let's say thanks to God who has given us guidance, happiness, healthy, and mercy so we can attend and participate in this special event without any obstacles. Excellencies, participants, ladies and gentlemen, before we proceed the program today, we would like to express our sincere gratitude to the Honorable Rector of Professor Dr. Hazairin SH University, Dr. Yulfi Perius, Master Science, the Honorable Dean of Faculty of Social and Political Science, Mrs. Harmiati, and also the Chairwoman of the ASEAN Studies Center, His Excellencies, Mr. Ade Patmo, Ambassador Permanent Representative of Indonesia to ASEAN, the Honorable Dr. Christoph Behrens, Senior Advisor to the Prime Minister of State of Schleswig-Holstein, Germany, the Honorable Ida Widyaningsi, PhD, Executive Director of Center for Decentralization and Participatory Development Research, Faculty of Social and Political Sciences, Pajajaran University, The Honorable Imran Sohan, PhD candidate, lecturer at Social Sciences Department, Khon Kaen University, Thailand. The Honorable Associate Professor Wan Amiza Wan Mahmud, Head Media Communication Program, School of Media and Communication Studies, Faculty of Social Sciences and Humanities, University of Kebanggan, Malaysia. The Honorable Dr. Alexander as lecturer at the Faculty of Social and Political Sciences, Professor Dr. Hazarin University, the Honorable Moderator Rizky Ananda, MPA, and the last but not least, also to the audience. Ladies and gentlemen, before we come to the main session, let's open this event with saying Basmalah.
Bismillahirrahmanirrahim.
Bismillahirrahmanirrahim.
Jangan lupa nanti speakernya, Pak.
Excellencies, participants, ladies and gentlemen, we are now going to listen to the opening speech delivered by the Rector of Professor Dr. Hazarin Ezha University for Dr. Yulvi Perius, Master Science. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi atau sore Tuan dan Nona.
Good morning or afternoon, ladies and gentlemen.
Yang terhormat Duta Besar atau Wakil Republik Indonesia ASEAN, Bapak Ade Patmo Sarwono.
The Honorable Ambassador, Permanent Representative of Indonesia to ASEAN, Mr. Ade Patmo Sarwono. Yang terhormat Ketua Pusat Studi ASEAN Universitas Profesor Dr. Hazairin Sarjana Hukum Bengkulu, Dr. Harmiati, MSI. The Honorable Chairwoman of the ASEAN Study Center of Profesor Dr. Hazairin SH University, Ibu Dr. Anda Harmiati, MSI.
Dan semua pembicara dan peserta yang diundang pada seminar dan konferensi internasional hari ini dengan topik membangun ketahanan pedesaan melawan dampak COVID-19.
And all of the invited speakers and participants on today's international seminar and conference with the topic Building the Rural Resilience Against COVID-19's Impact.
Pertama-tama, mari kita ucapkan terima kasih yang terbaik kepada Tuhan kita, Allah SWT, atas berkas dan perlindungannya pada kita.
First of all, let's present our best gratitude to our God, Allah Subhanahu wa Ta'ala, for His blessings and protections upon us.
Meski dihadapkan pada situasi pandemi ini, kita tetap diberkati dengan kesehatan, pikiran, dan jiwa yang baik. Sementara banyak saudara kita di luar sana pada saat yang sama berjuang hidup mereka melawan COVID-19.
Even though being faced by this pandemic situation, we are still blessed with good health, mind, and soul, while many of our brothers and sisters outside there at the same time are fighting for their lives against COVID-19.
Kami juga berdoa kepada Tuhan agar pada akhirnya Dia menyelamatkan mereka, memperkuat keluarga mereka, dan mengampuni jiwa orang-orang yang tidak berhasil pulih.
We also pray to God that He eventually saves them, strengthens their families, and forgives the souls of those who did not make it to recover.
Semoga jiwa-jiwa itu diberikan belas kasihannya dan pergi ke surga sebagai tempat yang kekal.
May those souls be granted with His mercy and go to heaven, the eternal place.
Kita tahu bahwa saat ini situasi di hampir setiap tempat di dunia relatif sama.
We know that at this time, the situation in almost every place around the world is relatively similar.
Sejenis virus yang diidentifikasi oleh WHO sebagai coronavirus 19 atau COVID-19 terus menjangkiti manusia.
A type of virus identified by WHO as coronavirus 19 or COVID-19 keeps infecting people.
Sejumlah orang dinyatakan selamat, tetapi sejumlah besar lainnya telah gugur.
Certain number of people are declared survived, but a great number of others have fallen.
Di Indonesia misalnya, sudah ada sekitar 8.000 pasien yang dipastikan meninggal dunia dari sekitar 200.000 kasus positif.
In Indonesia, for example, there have been around 8,000 patients confirmed die from around 200,000 positive cases.
Banyak kota besar yang biasanya menjadi tempat kegiatan sentra publik dulunya diisolasi atau diinstruksikan untuk melakukan pembatasan sosial skala besar.
Many big cities where the public central activities usually take place were used to be locked down or instructed to do large-scale social restriction.
Namun, karena situasi dilematis, memilih antara melakukan lockdown tapi mengorbankan ekonomi atau menyelamatkan ekonomi tetapi membiarkan rakyat rentan, pemerintah kita akhirnya berkompromi untuk menyelamatkan kedua aspek tersebut.
However, due to the dilemmatic situation, to choose between initiating lockdown but sacrificing the economy or saving the economy but letting people be vulnerable, our government has finally compromised to save both of the aspects.
Hal ini diwujudkan dalam kebijakan pemerintah baru yang disebut normal baru, di mana orang diizinkan untuk melakukan aktivitasnya, tetapi di bawah aturan yang sangat ketat dari protokol keamanan normal baru COVID-19.
It is manifested in the new government policy called the new normal, where people are allowed to do their activities, but under a very strict rule of COVID-19 new normal safety protocol.
Konsekuensinya ada pergeseran tanggung jawab yang sebelumnya sepenuhnya berada di tangan pemerintah, tetapi sekarang terletak pada disiplin masyarakat.
As the consequence, there is a shifting responsibility where previously it was fully on the government hand, but now it lies down on the people's discipline.
Jika mereka mematuhi protokol, mereka kemungkinan besar akan aman. Tetapi jika mereka lengah, mereka akan menjadi rentan untuk terinfeksi.
If they comply to the protocol, they will be likely to be safe, but if they let their guard down, they will become prone to be infected.
Sejak wabah COVID-19 pertama kali dimulai di kota-kota besar, banyak orang yang tinggal di sana menerima dampak yang paling tak terhindarkan.
Since the outbreak of COVID-19 firstly started in big cities, many people who stay there receive the most inevitable impact.
Namun di sisi lain, mereka juga memiliki kesempatan lebih besar untuk menyesuaikan diri dibandingkan dengan mereka yang tinggal di pedesaan.
However, on the other hand, they also gain a better chance to adjust compared to those who live in rural areas.
Pasalnya, ketika terjadi wabah di kota-kota, daerah pedesaan masih hampir tidak ada kasus infeksi atau status kawasan hijau.
This is because when the outbreak happened in cities, the rural areas were still having almost none, if not zero infection case, or green area status.
Ketika protokol normal baru pertama kali diterapkan di kota, banyak orang di pedesaan bahkan ragu apakah virus itu benar-benar ada.
When the new normal protocol firstly was applied on the cities, many people in rural areas were even doubt if the virus did really exist.
Akibatnya, seiring dengan pergerakan masyarakat yang tidak dapat dielakkan, virus corona yang tidak terdeteksi juga disebarkan oleh masyarakat secara tidak sengaja.
As the consequence, as the people movement is inevitable, undetectable coronaviruses at some point are also spread out, carried by people unintentionally.
Coronavirus.
Kita lihat banyak orang di kota-kota kecil termasuk pedesaan mulai terjangkit kasus infeksi.
Now, we see that the number of people in small cities, including rural areas, begin to have infection cases.
Namun, ini bukan waktunya untuk panik.
However, it is not the time to panic.
Memang kita perlu mempersiapkan diri untuk menghadapi virus ini.
Indeed, we need to get ourselves ready to deal with this virus.
Kita perlu memikirkan mekanisme agar masyarakat kita di pedesaan dapat memiliki ketahanan tidak hanya terhadap COVID-19, tapi juga dampaknya.
We need to think about a mechanism so that our people in rural areas could have a resilience against not only COVID-19, but also its impact.
Saya berharap melalui seminar ini dan ide-ide dari para pembicara undangan yang saya yakini memiliki kapasitas dan kapabilitas di bidangnya masing-masing, kita bisa tercerahkan dan tindakan strategis apa yang harus kita lakukan.
I hope through this seminar and ideas from the invited speakers whom I believe to have the capacity and capability in each of their expertise, we can be enlightened and know what necessarily strategic measurements should be taken.
Dengan mengucapkan Bismillahirrahmanirrahim, kegiatan seminar dan konferensi internasional hari ini dengan topik membangun ketahanan pedesaan melawan dampak COVID-19 secara resmi saya nyatakan dibuka.
By saying Bismillahirrahmanirrahim, this international seminar on the theme Building the Rural Resilience Against COVID-19's Impact is officially opened.
Mari belajar bersama, mencurahkan segenap waktu kita bersama pada seminar ini. Terima kasih.
Let's learn together and devote our time together to this seminar. Thank you very much.
Assalamualaikum warahmatullahi wabarakatuh.
Wabarakatuh. Thank you for the Honorable Dr. Yulvi Perius, Master Science, for the welcoming speech. Well, ladies and gentlemen, we're apologize because for the emergency condition, so Mr. Adi Patmo didn't come now to deliver the welcoming speech. Ladies and gentlemen, now we come into the main point. I would like to invite Mr. Rizky Ananda, MPA, to moderate the seminar today. Mr. Rizky, time and place are welcome.
Thank you so much for my sister. Hello everyone. Good morning, ladies and gentlemen. I'm going to introduce myself to you all first. I'm Rizky Ananda Putra. I'm as moderator for today. As we know, the Asian minister who handle Asian cooperations in determining policies related to the rural development, poverty alleviations in Asian by holding virtual meetings, by Zoom meetings. And several Asian countries or many Asian countries have taken steps to alleviate poverty and strengthen village resilience toward an inclusive, fair, sustainable, and recovery from the COVID-19 pandemic. It's starting from health policies, social welfare policies, and also economic policies. And sure, we would like to know how the Asian countries can build rural resilience during the COVID-19 pandemic. For the first sessions, we have two sessions for our discussions. In the first sessions, we already have three speakers. The first one is Imron Sosan. Imron Sosan is from Thailand. And the second one is Dr. Wan Hamizah from Malaysia. And the last or the three for this sessions is from Indonesia, Miss Dr. Ida Widyaningsih. And we are going to the first speaker. Let's get started. We call it Imron Sosan, PhD candidate. Mr. Imron Sosan is currently a lecturer at Public Administration Divisions, Social Department, Faculty Humanities and Social Science, Khon Kaen University. And also he teach non-profit organization management, and he is a PhD student in a public policy, Institute of Public Policy, Auckland, University Technology, New Zealand. And he served acting director, Institute for Dispute Resolution, Khon Kaen University. And he also served Secretary General Foundations for Education and Development of Muslim in Northeast Thailand. And he was appointed as Secretary General of Thailand Smart and Leadership Forum, supported by Regional Islamic Dakwah Council of Southeast Asia and the Pacific. And the last, he served as head trainer for governance tools in Thailand Civil Society Training Project supported by USAID SEPEN Program Thailand. So let's begin. Sawadee-kap, Achan, Imron. Are you still there?
Yes. Assalamualaikum.
Yeah, Achan.
Yeah.
Sawadee-kap, and please welcome, and time is yours.
Yes. Okay. Can I share with you my presentation?
Yeah.
Yeah. Okay. How many minutes for me? How long?
We are going to give you 15 until 20.
Okay.
20 minutes for presentation.
You give me the reminder, okay?
Yeah.
Yeah. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
For that kind introduction and invitation thank you for director for the committee, organizing committee, and Brother Rizky.
Yeah.
And the rest. Yeah, thank you so much. I'm here from Auckland, from New Zealand. Now we are in the afternoon session here. Yeah, I first of all I would like to thank our speakers and our participant here. I will spend my time to present my presentation briefly because the time is limited. My presentation is about it's part of my research now, my PhD research. My PhD research is about faith-based faith community for sustainable development. This topic I got from I extracted from some part of that. My topic is about the constructive role of faith community as social provider in strengthening the rural community in turmoil of COVID-19, a challenging context of Thailand. Yes, what I'm trying to do. My presentation would be divided into the first one is the significance of faith community in terms of the crisis. The second one is about faith community and its components as a social provider during the COVID-19 last several months ago. And the part three is about way forward. What we are looking at and challenges and opportunities. Yes, the significance of faith community during the crisis, the whole society, the whole communities in Thailand and the rest of ASEAN countries have been affected and challenged by the pandemic. Everything has been changed, everything has been adopted into new era. Some said which is called new normal, but I would call it new chance in order to get back our principle. As the whole, in the overall of faith community, I could say that the people, the humanity, about 80% out of the whole population now of human community are being classify themselves as religious. That's a research done by Pew Research Center. If somebody wants to know about religions, about religion, the role of religion, you should go in and search for the Pew Research Center. That's fine. And I just this point is about I would like to say that because everybody has its own faith, its own principle, its own belief, and that those beliefs, those religions affecting their own practice and daily life. Yes, faith matters to people. Faith has been absent in development policy and practices, even in Thailand or some areas. Faith is the attitude of trust. Faith can bring people together. That is why I now am focusing on faith community and faith-based organization within that community, because I believe in the potential of faith that can bring people together. Yes, definitely, faith community have been recognized by UN, by SDG, by WHO, by World Economic Forum, and even Thai government recognizes that faith community. But the problem is that how to drive, how to bring that reputation in order to make the good for people by faith community. Yes, history from MDGs to SDG. Now we are heading, into the end of SDG 10 years from now on. But faith communities or faith-based organizations are part of SDG achievement. There's a room for faith organization, of course, but we have to study, to research more about the role of this faith. Definitely, faith community in modern policy or development context, as public sectors, public concern. When we talk about faith, we talk about extremism, we talk about terrorism, or sometimes we talk about faith-based sectors for development, or even the mosque, the church, the synagogues, whatever. They are already, they become community models, community asset. Definitely, they now becoming a social provider too. My focus is about social providers. Yeah, definitely we recognize the Constitution of Thailand recognizes. Yeah, and this is my area, my research area. I am now conducting my research in Northeast area, Northeast region. We call Isan region, where Muslim is a tiny community, but living together with majority Buddhists. Yes, definitely we are impacting on the policies from ASEAN, from Thailand, from Thailand national strategy 20 years, whatever. We are in the middle of those policy contexts, because the COVID-19 policy context are impacting on many, on all faith communities as a whole now. Yes, this is my research area community. I'm conducting this research in the village, a small village which is called An Mubarak Muslim community. In there is a school, foundation, mosque, and club for women, for converted Muslim. Yeah, this is the background of institutional context. Yeah, this is the first part is about why we have to study, we have to focus on faith community, because they are part of the development, they are part of our life, they are part of all the policy practices and policy implementation. And the part two, I would like to talk about faith community as social provider. The faith community is a safe place for believers during the crisis, and Muslim organizations. Can I say something? Okay, that's the whole picture of faith community. But my research, my talking is about Muslim communities or Muslim organization. I specify, I narrow into just that. Part two, we say that faith community, a safe place for believer and all, and Muslim organization provided full social services for Muslim and non-Muslim during the peak of COVID-19 last few months ago. And now the role of active citizen is a key player in making resilient to people in need. Yes, this is a Thai context, Thai Muslim context. They are thinking about how to protect mosques, how to protect Muslims and they don't want they don't want almost all community to be a center of the spread of crisis. Yes, it is indeed. I would say that Muslim community are responsible for wider society, because if mosque becoming a spreader or spreader of COVID-19, that's asterisk. That's not good for Muslim community, for faith of community, because even mosque, church, temple, must avoid in order to be in order to be either victim or to be to be victim or to be the spreader for the COVID-19. Yes, and then in the Shaykhul Islam is the head of the Muslim communities, try to measure up with the encouragement of health authority in Thailand, try to also measure or try to issue the measure that all Muslim community, all Muslim people must able to abide by the rules and measures issued by Shaykhul Islam, because the measure rely on the advice and suggestion of the health ministry or the health authority, and definitely all Muslim must restrain and follow the rule for the safety of all people, not only for Muslim people but for neighborhoods too. But neighbors must be protected too. I mean, neighbors mean non-Muslim Buddhist community. Yes, in Muslim in the mosque, kutubah or Islamic sermon has been a powerful instrument. It is good for all khatibs or imam in order to encourage Muslims to follow the principle, on pandemic management during the Prophet or during the Caliph. That's the challenge. That's the opportunity that all Muslims must back or must reconsider the knowledge, the norms, the principle relating to pandemic. Definitely, there was a tension among Muslims in Thailand during that time, because almost must be already closed, and we couldn't go to the mosque to pray daily prayers, particularly in the month of Ramadan. We couldn't go to pray Tarawih there. We couldn't go to pray to pray Isha, Maghrib, whatever as you did before. That's challenge. Very, very challenging moment of Muslim. There is contradiction among Muslim. Some said, why you have to close the mosque? Some said, why you don't allow us to go there? Because that's a challenging time in order to seek more knowledge for Muslim community. And that's the COVID try to create, I don't know, by default, COVID-19 created a new rules of mosque and community. We have to think about more than what we have done in the past. Definitely, this is some pictures from my community, from my area. Everything changed. Even Indonesia in some and every. We have to think about the knowledge, new understanding of the Islamic principle. We have to think about that. But the most attempting to give the believer those knowledge of understanding, new understanding. This is, but not easy for Muslim who pray at the mosque daily. Not easy to stop them to go there. Yeah, this is one. The second one, Muslim community, Muslim organization already had a chance to work together with the public and private sector in community in rural areas. Yeah, mutual respect, mutual collaboration between communities, Muslim community and public sector, private sector. They have a chance to talk together. They had a chance to get to know each other during the crisis, because Muslim community already opened their own space for welcoming others into society.
Dr. Imran?
Yeah.
Sorry for bothering you. You have 3 minutes left for presentation.
Okay. And definitely the Supreme Muslim leader acknowledged Muslim community for their participation during the COVID-19. And together this is a campaign for the networks of Muslim organization. Together we fight against COVID-19. They are talking a lot about humanitarian work or aid work. Yes, they provided a hand gel sanitizer for people. They provided iftar campaigns for the poor during the crisis, particularly the holy month of Ramadan. Right, this is the program for iftar, and also this time has been driven by the relationship between Muslim and non-Muslim, this Achan. And also they talk about aid package program for the poor and the people in need of food. This is the Muslim Muslim community and their organization trying to do. Definitely individual. I think active citizen individuals are active, are responsible, or are already engaged with the campaign for wider society. There is a campaign which is called Muslim Care Campaign for Food, initiated by active individual for people in need, unemployed, poor, even volunteer for during the COVID-19. Yes, now this campaign is still going on like this. You can see the relationship between Muslim and non-Muslim. You can see this picture. We become social provider for the rest. This is important because most of them becoming volunteers, community volunteer for their own community, because of COVID-19. I don't say COVID-19 is good, but I can say COVID-19 providing a chance, an opportunity to do something that we never done. And okay, the last question: way forward, challenges and opportunity for faith community as social provider. Now, our faith community must think about collective leadership. As individual can come together to think about that, because people trusted. People gave them trust because they have a trust, because they have a trust building among the people. They trust mosque, they trust imam, they trust organization. Is it why all the money, all the donation come from people who trust the organization, who trust mosque? And then they donated because of trust building. The problem is that how to sustain the contribution in order to continue after the COVID-19. That's the challenge. That's the challenge. But now after Ramadan, we got some problem. Maybe the contribution still low, but after that, how to contribute, how to sustain our contribution. And definitely our faith community must be part of all activities, not just as religious, but social justice, social services. Faith community, faith organization must think about that. We have to go beyond our own identity. Yes, but faith communities are home to people who believe in social change. I think this is the challenge, but they now are doing a resilience among people in need during the crisis. Can I conclude this one? If we want to be participatory, if you want to be to be responsible community, I think we have to maintain, we have to strengthen our tools. Those two are mosque, are foundation. Those two are community organization. Those organization, faith-based organization, must be responsible or must be trained in order to be a social provider in the future. Yeah, thank you so much.
Okay, thank you so much for your presentation, Dr. Imran, about faith community, particularly focusing on Muslim organizations as social providers in strengthening the rural communities in Thailand during the crisis COVID-19. Nonetheless, there is a significant challenge for the Muslim organizations to sustain their capacity and strength to contribute their social services to the broader communities in this time of a crisis in challenging of Thailand context. Okay, we are going to the welcoming speech first because now the Asian representative Indonesia to the Asians, Dr. Ade Patmo. Dr. Ade Patmo has joined our discussions, and for Mr. Ade Patmo, we give a time for welcoming speech first. So time is yours, Mr. Ade Patmo.
Terima kasih. Thank you. I hope you can hear me. Sorry to interrupt the starting the discussion because probably some miscommunication, but I'm happy to be able to join this webinar and give some few words on opening speech. But let me begin by acknowledging the rector of the Professor Dr. Hasarin SH. I hope Pak Rector is still here, Engineer Zulfi Perius MSI, and of course I would like to acknowledge as well the Dean of Faculty Social Science of the University, is also the chairwoman of the ASEAN Study Center in the university. Distinguished speaker, participant of the webinar, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Very good morning, who in Jakarta or Indonesia, and afternoon from New Zealand. So happy to listen to you. Congratulate to ASEAN Study Center of Professor Dr. Hasarin SH University in organizing today webinar. I think it's very timely and also good to have this kind of discussion webinar, in particularly on the building the rural resilience against COVID-19 impact. When COVID-19 starts spreading around the world, ASEAN, I will that was my opening speech on ASEAN, has acted swiftly and decisively by taking some initial step and action. We are very fortunate to some extent that the sense of regional solidarity has helped us in implementing those action. Now, as the world is grappling with how to contain the pandemic and re-energize the economy, ASEAN continue taking steps to fight COVID-19 and developing measures to mitigate the impact of COVID-19. Of course, as well, we have to prepare the future public health emergency. So I've been listening to what Imran, by Imran presentation. I think is a good presentation, and this is also relevant to ASEAN, where our approach in responding the pandemic is always based on the ASEAN main objective is building a stronger ASEAN community. If we start from the community from the bottom, from the rural area, city, and country, and hopefully it will be a better and stronger ASEAN in the region. So let me also share what ASEAN has done, in the health and other sector due to address the COVID-19. We already have some mechanism that to deal with, address, and coordinate to maximize capacity to respond this emerging public health threat. We also develop ASEAN Response Fund, is the financial resource to provide support member state. Especially this is focused for the medical and health who have the need to support when they're doing their job. We also to prepare medical supplies as well, equipment for public emergency. This is a process that we are still doing, preparing this for ASEAN well prepared in facing any public health emergency. Since also that is also mentioned by Pak Rector, this issue of COVID-19 pandemic is not only about health, but in fact has also impact in wide-ranging social economic. This is important that all need to be addressed in the same time. Now, while we still facing this pandemic and this social economic impact of the pandemic is also that's the economic, as I mentioned before, and we in ASEAN has doing everything to address this together, and also as ASEAN also bilaterally. In this regard, for prepare that, ASEAN is also in the process of developing a framework for especially for recovery when the COVID-19 is already gradually, hopefully, disappear. Because what we are facing now, we are facing economic challenges due to COVID-19. Many business sectors are in trouble. now ASEAN has already started developing an ASEAN Comprehensive Recovery Framework, as I mentioned uh, before. This framework is focused on post-pandemic recovery plan, laid down strategies and key priorities to restore ASEAN connectivity, tourism, normal business, and social activities, to prevent potential economic downturn and find way to share a lesson learned. The most also this situation also hit the community in the rural area. Then especially for the micro, small, medium enterprise, which are actually at the basis and the foundation of economic development. Rural areas also contribute in providing our basic need. If we are talking about agriculture, if this pandemic prolong, it will have a challenge, especially on our food security. So we need to have to think how to address this. But on the other side, with this current situation, it's also show that the importance of using the digital technology, like what we are doing now. We are more using a digital connection rather than physical. Is becoming our in the future daily activity. And importantly as well is this digital innovation or digital technology, how to use it for our education. In the future, our education probably is not the same as like now. So this is very important that the university and all the practitioner educator be able to adapt and as well to adjust with the current situation, especially in giving the teaching using digital technology. Coming back also in the commodity, I mentioned about agriculture as well. The university also probably could also, teaching and giving information on for our farmer who are working in agriculture sector to utilize further on the digital technology, because this will be there also their future. So coming back with the pandemic has no border, as all knows. No country is immune from it, no matter how powerful, how prosperous those countries. And this connection, ASEAN, in the effort to combat the pandemic, also involve our ASEAN partners under various mechanisms. In ASEAN, we have a mechanism like ASEAN +1, ASEAN +3, East Asia Summit, among others. So we are working jointly to create and establish a regional health resilience. So Indonesia also, we come up with several initiatives in mitigating, addressing COVID-19. There are several initiatives still are under consideration and discussion within ASEAN. To name the few of Indonesia initiative, it's like cross-border contact tracing and ASEAN +3 pandemic task force and ASEAN travel corridor arrangement. That's among some of the Indonesia initiatives. There are several, but I just mentioned some. This initiative is not only cover about health, also about how to restart again in coming times, about travel, about connectivity, people mobility that also been mentioned at the beginning as well. So, ladies and gentlemen, all the participants, the work of ASEAN is not done yet. There are still many issues need to be addressed. We always emphasize that important to redouble our efforts in finding ways and means to overcome current challenges. Our action should not be ordinary because the challenge is extraordinary. In fighting the pandemic, should involve all elements of the society. Government and people must work hand in hand. By strengthening our unity and solidarity, we can win this better. Today's webinar is an example of society involvement in building community resilience and for adapting the current challenge. Hopefully, it will also contribute not only to our individual countries, but also a strong regional health resilience. In closing, I wish a fruitful and successful webinar, and I hope something can come up from this discussion for have a more better understanding about how we be able to adapt betterly on the impact of COVID-19. So with that, I thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for coming and taking time and also giving a welcoming speech in the middle of your busy activity today, Mr. Ade Patmo. And we are going to the second speaker. The second speaker is Associate Professor. We call it Miss Wan Hamizah. Wan Hamizah got BSc Chemistry, University Western of Australia, and he got master degree in Modern Language Studies, University Malay, and also finished a PhD Communications, University Kebangsaan Malaysia, and now he had Media Communication Program, School of Media and Communication Studies, Faculty of Social Science Humanities, University Kebangsaan Malaysia, and she has specializations about media and communication policies, film censorship, broadcasting system, youth, social transformation, translations, and also subtitling. So please welcome Miss Wan Hamizah, Associate Professor Wan Hamizah. Please welcome, and time is yours.
All right, thank you very much, Rizky Ananda. Assalamualaikum warahmatullahi wabarakatuh. Welcome everyone. Thank you for inviting me. My name is Associate Professor Dr. Wan Hamizah, Wan Mahmud from the University Kebangsaan Malaysia from Kuala Lumpur. A very nice day here in Kuala Lumpur. The paper that I will be presenting is can you see? Hello?
Yeah, we could see.
Okay. All right. Okay, I'll be talking about communication strategy because of my background in communication. So in terms of building the rural resilience, this paper will be talking about communicating the government policy as a strategy to build rural resilience against COVID-19 impact. Okay, these are some statistics on COVID-19 in Malaysia. The first case was confirmed in Sabah on the 25th of January, early this year. It's actually a tourist from China that went to Sabah. And after that, once we have tourists from China in Sabah, then we have cases that came to Langkawi and also from Singapore. And by the 1st of February, the Malaysian government has restricted the travel from Chinese citizens and also foreigners who visited China, for example, from South Korea and Japan. And the first case of local infection was detected on the 6th of February. And by the 11th of February, a task force was formed between Malaysia and Singapore because of the close contact. And we have many Malaysians working in Singapore, and they commute between the two countries. And by that time, the first economic stimulus package was announced in March. But at that time, we have a government change of government from Tun Mahathir to Tan Sri Muhyiddin Yassin around that time. And by March, we have cases have spiked up. And on the 11th of March, the first case of the Tabligh cluster from the Sri Petaling Mosque was detected. And it goes on for about 4 months until around July, when the cluster was officially closed, with 3,375 positive cases out of more than 42,000 samples tested. And from that, we have 34 deaths. Is the most number of deaths within that comes from one cluster. And I think as of yesterday, we had about 135 deaths in Malaysia. And by 18th of March, the first phase of MCO was implemented under the Prevention and Control of Infectious Disease Act and also Police Act. So, and the MCO or Movement Control Order is still implemented until the 31st of December this year. Okay, now let's talk about urban versus rural. I'm sorry, the data was picked up from the Ministry of Rural Development website, and it's written in Malay, but I will translate it for you. The data for 2018, Malaysian population is about 32 million, or slightly more than 32 million. And 1/4 lives in rural, and about three quarters live in the cities or in urban. The scenario in Malaysia could be different from Indonesia because of these statistics, for example. Therefore, in Malaysia, we are not looking so much into rural and urban, but we are more looking into the income status of each person, and we divide them according to that. That's why we have this like 40, the bottom 40. So you can be living in urban, but you are still poor. So we look at the income and we categorize into 3 categories, which is T20 or the top 20% of income earners, M40 and B40. And basically when we are helping out, is mostly to the B40 category and not so much of rural, because we also have rich people or the T20 people living in rural areas. Okay. Right. Why rural? Okay, number one, we have a large share number of population who are at higher risk for severe illness, notably the elderly and the poor. We still have a lot of parents still living in kampongs while their children have moved to cities. and because of that, they have a higher risk of severe illness, and therefore the Malaysian government has to make some intervention to help them. Number two is the health centers. They are typically not well suited for dealing with COVID-19, especially in the rural areas. They are basically for the common colds or the common diseases, but not fit to handle a deathly virus such as COVID-19. So therefore, the rural healthcare facilities are being upgraded to handle the COVID-19 testing. What the government of Malaysia have done is that we closed off certain communities during the MCO. For example, the Aborigines community, all the roads to their village have been closed and no one is allowed to go in or out. So in that way, they are quite isolated and therefore they are quite okay. Number three, why rural and why the Malaysian government intervention is because we have a high share of workers in agriculture in the rural area, and coupled with a limited capability to undertake these jobs from home. Okay, this makes teleworking and social distancing much harder to implement. So what happened was the government has imposed standard operating procedures, and which are very sectorial. So for the agricultural sectors, they have a specific standard operating procedures. For example, for the estates, for the farms and so forth. Okay, number four is because rural area have lower incomes and also lower savings, and they have probably forced to work and they don't have the time to visit hospital if they are required to go to hospital. And the government aids for the people. The Malaysian government has so far announced an economic or has launched and also given economic stimulus package amounting to about 290 billion ringgit, or equivalent to 67 billion US dollar. Okay, to be distributed, and we just had one recently. So these are some examples of the government aid. We have iSuri, these are for housewives only. We have PEKA, these are for the healthcare scheme. We have MyRapid, these are unlimited rights for the B40, back to school aid for the school children. We also have MySalam, this is an insurance policy. We have a 40 ringgit electric rebate program. So 40 ringgit per month slash out from our monthly electricity bill, because the government thinks that, and you stay a lot more at home, so you use more electricity, and therefore that's one way of how the government can help. And they also have the household living aid for every household. Okay, and the number five, by staying in the rural, there's a large digital divide with lower accessibility to internet, in coverage and also connection speed, and probably have fewer people with adequate devices and the required skills to use them. So therefore, the government will improve the broadband services to the rural area. All right, now we have seen why the rural areas are being need to be helped, or to increase their resilience. So therefore, the government has also have some communication strategies pertaining to this. So number one, we have COVID-19 hotline managed by the Crisis Preparedness and Response Center, or CPRC. So this hotline can be, so anybody can call at any time and ask any questions related to CPRD. This CPRC center is handled by the Ministry of Health and also Ministry of Information. Or they can also email or WhatsApp to the numbers there. Second, the Ministry of Information has introduced Info on Wheels, in which they disseminate information like posters and also brochures to almost 60,000 locations in Malaysia since end of January until recently. Okay, and it is still going on, and they produce more than about 45,000 news reports, public service announcements made on radio and television. All the ministry or all the departments under the Ministry of Information has been working together to disseminate information to all people, and everybody can have information through handphone, through television, through radio, or even through newspapers as well. Okay, communication, the strategy number 3 is that in Malaysia, we implement daily scheduled communication. Is usually live news press conference at noon by Datuk Sri Ismail Sabri Yaakob, our Minister of Defence. He's a senior minister there, and he will appear almost every day. Or if he is not, then a press release would be given out at noon every day without fail. And at 5 p.m., we have the Director General of Health, Datuk Noor Hisham, who will appear at 5 p.m. almost daily. But now, normally on Sunday, he'll take a break. But recently, we waited every day at 5 p.m. in front of the television to hear how many cases has gone up or has gone down and what happened today. Situation of COVID in Malaysia. Okay. And that another strategy is that all the information were divided between health and non-health related matters, and they have these 2 main spokespersons. These are very vital to ensure that the people receive only one voice, and it managed to lessen the public anxiety, and also to reduce the spread of false information around the country. And number 5, the government has also enforced the application MySejahtera as a main source of data for contact tracing. So everywhere we go, we have to check in with this MySejahtera, and anyone who comes into Malaysia has to download this application and also use it everywhere. If you don't use it or you don't check in with MySejahtera, you may be liable to be fined 1,000 ringgit by the police. All right. Okay, this is one example when sometimes our Prime Minister would also appear on television and on radio to give some advice.
Kerajaan telah bersetuju untuk menangguhkan bayaran balik PTPTN kepada semua peminjam selama 6 bulan.
PTPTN is for students.
Sebanyak RM750 juta. 750 juta ringgit. Kini kerajaan bersetuju memberikan penangguhan bayaran balik pinjaman untuk tempoh yang sama kepada peminjam Perbadanan Tabung Pembangunan Kemahiran ataupun PTPK mulai 1 April 2020 sehingga 30 September 2020 dengan anggaran kutipan sebanyak 149.2 juta ringgit. Inisiatif ini akan memanfaatkan seramai 174,500 orang peminjam.
All right. So by curating clear and persuasive messages consistently, the Malaysian government has succeeded to lessen the public's anxiety, reduce circulation of false information, and also promote the correct health prevention behaviors. So this is one of the findings from a research by my colleague here in UKM. And okay, I also forget to inform you that Datuk Sri Noor Hisham was an alumni alumni from UKM as well. Okay. So with these strategies implemented by the government, we found out that most people in Malaysia have a high rate of knowledge regarding COVID-19 prevention. And also, most people in Malaysia has also showed a high rate of positive attitude towards the way the government is handling the crisis. In fact, Azlan et al. 2020 has also found that the people or older people has more knowledge about COVID than the younger generations. Okay, and because of these strategies, the Malaysia has been ranked the second most successful country in the fight against COVID-19 after Taiwan. There's a research that found that. And I think that's about it. Thank you very much.
Okay.
So I pass back to you, Ricky. Rizky?
Thank you so much, Dr. Wan Hamiza, for your presentations. It's very interesting presentations, including the presentation of detailed data of the communication strategy, especially of Malaysia, so that Malaysia has the second highest level for protecting or anticipate COVID-19's impact. And the third speaker is, wait, just a moment. The third speaker is, we call it Ida Widyaningsih. Ida Widyaningsih got MA from Flinders University, Australia, and got PhD from Flinders University also. And Dr. Ida Widyaningsih is the Executive Director of Center for Decentralizations and Participatory Development Research of Faculty of Social and Science, Pajajaran University, and also Senior Advisor of Common Room Network Foundations, Bandung. So please welcome Dr. Ida Widyaningsih. Dr. Ida Widyaningsih, please take it your time.
Okay. Thank you very much, Rizky. Okay, honorable guests and ambassador for ASEAN. Thank you very much for being here with us to discuss very critical issues on the challenge of society in ASEAN. It is very interesting talk discussed by previous speakers on how the strategy of the government to deal with this current issues. I'd like to share something that actually related to the previous speakers' discussion, but I take a chance to discuss a case that actually I've been working with some colleagues on building rural resilience in an indigenous community. Let me share my presentation. Okay, I hope everyone can see the slide. Okay, I'm sorry. Can you see my slide? Because I just want to make sure that everything is there.
Yes.
Okay, thank you very much. As we know that actually, as mentioned earlier, that actually COVID-19 is something that really unexpected. It was started in China and then spread very quickly to the different part of the world, including Indonesia. And in Indonesia, no, we still fighting how to cope with the issues because the number keep rising, and we don't know yet when actually we will have opportunity to have a better strategy to maybe not only stopping but at least declining the number, because the number every day keep climbing in Indonesia. And actually, as the senior advisor of Common Room Network Foundation in Bandung, actually we've been working with some people in the in the rural area because we have concern about the development gap in Indonesia, that most of Indonesians live in rural areas, and unfortunately, even though they have a resource to produce some agricultural products, they are considered as poor farmers. So most of those who work in the farming area in Indonesia, they don't really have a good position in terms of economic and welfare. So when it comes to COVID-19, again, we are thinking that they are actually the one who are actually has the highest risk compared to other region. Okay. Well, I would like to share this slide just to remind why the reason why we're working with indigenous community, because there's a statement, very interesting statement from Yale School of Forestry and Environmental Studies saying that one estimate say that while native peoples only comprise of some 4 or 5% of the world population, they use almost a quarter of the world land surface and manage 11% of its forests. In doing so, they maintain 80% of the planet's biodiversity, or adjacent to 80% of the world protected areas. So based on this, we've been working with the indigenous community formally since 2013. However, the work is actually has been done by our late Professor Kusnaka. He's been working with this community since 1990s. So he's one of my professor in anthropology. So my discussion will be briefly discuss about where actually what is Kasepuhan Cipta Gelar Village as an indigenous community institution in West Java and Banten province, and then how actually the impact of pandemic in rural area, and also we discuss about what actually we are doing. We're just making what we call a small adjustment toward resilient village. Kasepuhan Cipta Gelar Village, it is actually a Sundanese-based culture. As you know, Indonesia is a very rich region with different cultures and languages across Indonesia, from Aceh to Papua. But we are working closely with Kasepuhan Cipta Gelar because it is located very close to our place, even though we need to travel for about 8 hours to go to Cipta Gelar. And this community part of what in Indonesian context called as indigenous community institution or masyarakat hukum adat, which is as known also as Pancer Pangawinan community. So this community existed in Indonesia actually very long time, since 1368. So in the 13th century, this community already there. However, because of the dynamic of the society, we don't really recognize them as a formal state institution, but the community has existed since 13th century. So the population of the Kasepuhan Cipta Gelar, this is the data from last year, the population ranging from 25,000 to 30,000. Why we say range? Because they don't really do the formal survey for the community, but they had different way to connect and collect the data of how many people actually part of the Kasepuhan. And they are located in West Java, Sukabumi Regency, Bogor Regency, and also in Lebak Regency. So practically, they are actually not only not only located in West Java, but it is also across another province called Banten province. So this is the uniqueness of the community. They don't really stay following the state border, but they are following the traditional definition of state border. And in this community, they has a main stakeholder tradition institution. So the Kasepuhan Cipta Gelar Indigenous Community Institution, actually the safeguard of the tropical forest in the Halimun Salak National Park region. So they are actually playing a very critical role in saving environment, because they have local value that are actually protecting the environment. So we, because we've been working with them since 2013, we made some initial discussion and project in 2013, and in 2015, for example, we got some funding from Germany, Gesellschaft Internationale Zusammenarbeit, that's the international German International Cooperation Agency. We got some funding to establish what we call as internet for agriculture. So we make a project called Innovation Factory at the time. So we work with them to support them, because to our understanding, when we work with them, because they are very isolated on the top of the Salak Mountain, they don't really have very good infrastructure. So they live in a very traditional way. They don't really have very good access to modern health system. So we start working with them, and we see in 2015 we start working, and then in 2016 when we talk with the elder, we discuss how important it is to have a good access to information. Then we have some meeting with other elder and some youth. So regarding to the COVID, because the COVID initiative is something really an adjustment of our activities, because initially we are working on how to open alternative internet access for local people as a vehicle for local economic development without ruining their traditional system. But due to the COVID situation at that time, we got to stop our activities, and then we also have the request from our funding to have a look at the COVID issue. Because to be frank, none of our researchers can travel to that area, because the Kasepuhan elder also restricted any people to come to the village. Kasepuhan Cipta Gelar for in the last 10 years also became very famous, and so many people want to visit that area. So they are actually quite open to foreigners or other people to come to visit them, but they don't really want to be called as a tourism area, because they want to keep their tradition. So related to this project, then we know that it is not really easy to continue our initiative due to the pandemic, because we don't want to risk them, as well as we don't want to take a risk of being exposed to the COVID-19 outbreak. And then we understand that in Indonesia, in Indonesian context, considering the statistic of COVID-19 in Indonesia, we knew that actually Indonesia is suspected to become one of the biggest epicenter of the COVID-19 pandemic in Southeast Asia. And we don't know, we're still waiting the statistic. And then the center of the pandemic widespread was initially concentrated in big city like Java, Bali region, but also now it is increasing cases in other places in Indonesia, including Sumatra, West Java, West Nusa Tenggara, Maluku, and Jambi. Even we know some almost all of Indonesian region now contracted to this pandemic. And we're also seeing that sooner and later, because of the people mobilization, the pandemic will spread to remote places of Indonesia, including to rural area and remote island. People in rural places and remote islands are likely to be exposed after the pandemic outbreak is happening in urban area, and it is actually proven. Now we can see small places and small rural area also not really clean from this virus. And then we think that it is important to pay attention to this issue, because there is a lack of awareness and knowledge due to the limited access of information and education in rural area. And also, as I mentioned before, in rural area, especially the one with a very long trip to access them, like in Cipta Gelar, limited access to health services is prominent. It is very difficult to find health workers. So they are actually rely on traditional remedies and all traditional systems. So they need about 6 hours at least to go down to the city, to the closest community health service. In certain cases, rural areas and remote islands are difficult to access and making it more challenging to handle the COVID-19 pandemic. So we actually start to design the preventive and promotive activities in the area. The first activities actually—
These are the top results.
Sorry, we start to develop the awareness and capacity building. So we discuss with the elderly, with some youth, women in the community to make them understand how important it is, the issue. So we talked to the village leaders first, and then we had the gathering with elderly and young people, and also students and women and mothers who can be directly involved in anticipating and mitigating the COVID-19 pandemic in their respective regions. Because indigenous community, they have a different way to understand some issues. We couldn't go directly to them. We have to talk with the village leaders first, and then based on his direction, then we can reach the local people. And after the target of awareness and capacity building, we are using the digital media, as Professor Wan mentioned, that in rural area in Malaysia also had some problem related to internet access. So similar cases actually happening here in Indonesia as well as in West Java. Even though, for example, our recent governor introduced digital village, smart village, it is actually not really well implemented up to now. So especially in the place that actually very remote, because the internet will be very expensive and also very difficult to get some access. So this is why we are working on production and conventional digital media content as a vehicle to deliver credible COVID-19 information using local languages and cultural approach that are easily understood by the local community. For your information, local people in this indigenous village actually mostly using Sundanese language all the time, even though they understand Indonesian language, but they prefer to use local language. And the third activity is actually related to developing a protocols and standard operating procedure for the COVID-19 pandemic preparedness and resilience initiative that can be replicated and adapted by communities in rural areas and remote island. Actually, we produce a book, actually, a very small book based on the discussion and the knowledge in that area. And this book now actually printed and distributed in some other villages in Indonesia by West Java government. So we created the book and then we just gave the soft copy, and then they printed, because we were only able to print only 1,000, but now I think that it is actually accessible online and anyone can use that book. So, and the last one is actually we are trying to develop what we call as integrated information system, because it is very important to make a support, because it is not enough just to give them information, but also we have also to develop the monitoring process, the extent to understand the extent to which the community implement the procedure. So this is the book that I was talking about. It's called Nyinglar Virus Corona, Kampung Siaga COVID-19. So it means that how understanding the coronavirus. So it is in Sundanese language, not in Indonesia language. And we also draw a local situation and local picture and illustration based on local people and situation in that village in Cipta Gelar. And for this book, actually, we got some support from UK Aid, and this book is now available free for anyone who want to work with community. Even though, and also one of my other project in UNPAD, for example, Amari UNPAD, also talking with how to support villagers to survive or to mitigate the issue of COVID-19, also using this book as the handbook for that very handy for local community. So in this book, we talk about what is the virus and how to deal with the virus, and as well as what is the indicators and how to avoid the virus, etc., etc. And we also give some Sundanese language like dictionary at the end of this book. So and this one is actually one of the elderly in our system. Probably we could consider him as a prime minister in that community. So we made him as the illustration for this. So it is easier for the people to read and okay, this is us. Then they want to use that book to understand more about the virus. And also another program is actually we are also concerned about the curing and rehabilitation in case if the pandemic 19 or the novel coronavirus came to that village. We also introduced them how to deal with that. So we provide local service for handling COVID-19 pandemic case, including building the new facilities like hand wash basin, but actually really very local style. And also we give them not only knowledge, but also we train some volunteers from local people to work with the community. And we also make a connection with local clinic or community health service, Puskesmas in Indonesia. And also, we also introduce how to connect with the hospital in case the worst scenario happening. So we introduce how to access the service from the regional general hospital and how to make a referral to the hospital if the severe COVID-19 happening in that village. And also another strategy is we maximize the use of telemedicine platform for the consultation and handling of basic health service COVID-19 pandemic cases that can still be handled at the village level. So for this, we are also introducing at the same time, actually, Universitas Padjadjaran developed a software called Amari. That's an application that helping people to make self-identification, whether they are healthy now, whether they need to go to see the doctor, or they can make another a very strategic and practical decision to deal with COVID-19. And this platform actually has some advantage in terms of protecting not only people, but also protecting the medical doctors, nurses, and also all of the health people who work in the health service area, because they don't need to always connect or meet people in person. They can make a tele consultation. So we try to do this because we don't want to lose too many health service people who work in the health area. And then we also try to provide some other health facilities, as well as the health workers. So there is like an isolation room in the village, and we also send some health workers to the village, yeah, in case of emergency. Uh, and because as we talked before, that this project is an additional activities for our initial project on women and youth empowerment, we're also thinking about the long-term impact resolution, because COVID-19 at the end is not only dealing with health problem, but also with other social economic impact on the issue. This is why we also try to support a local community, because when people have to isolate themselves, most of the time people have no choice. They have no some people have no income at all. This is why we provide also a labor intensive employment at the village level related to our project. And also we try to make identify the potential agriculture products that can be developed in the relevant areas. And another activities is improving the skills and capacity of local community, especially young women, young people and women, and also development and diversification of agricultural products to increase an added value. This one actually, we conducted these activities prior to the lockdown, before the COVID came to Indonesia. Luckily, we already conducted the training and also comparative study to South Bandung area, because we think that sometimes it's not really easy to introduce new knowledge to youth in some special area, because they need to see, they need to talk with other farmers how to make a change. They need to learn what is actually happening in real life. This is why we took them to Bandung. I think that in the early March, before the and collaboration with digital marketplace to channel existing agricultural product to urban area, and we're still working on it. But actually, why we farmer and farming, because most of people, or most of the Kasepuhan Cipta actually are farmers. They mostly but they also have hard farming. This is something rice. They are not all rice, because rice is something that can't sell it. So if you can't buy anything, but you can ask to any house to give you some rice. So you can sell something else, but not rice in that place. So because some of the community also still connected with other people from outside, so they are in high risk of economic loss, because they are not really going out from the village. They don't also not they don't allow people also to come to the village. So because of this, we are thinking that long-term impact solution should be addressed in terms of COVID-19. And this is actually our next activities. We will have rural ICT Camp 2020 in Cipta Gelar next month, and but it has a very strong protocol. We work with some volunteers as well as some local government official to discuss about how to improve the information technology in the village to open the access for the local people. And this is actually some of example of our activities. So we started working for this women and youth in Cipta Gelar in the late of November, and also we have some. Oh, sorry. Sorry. Okay. I just showing this one. This is the use of the Cipta Gelar. We asked them to join us to go to visit another successful farmer group in south of Bandung. So using this methodology, actually they learn something new, and we still communicate with them online, and they said they got some very good inspiration from their trip to Bandung, and they are now start to develop some of the product so they can sell it in a better price. So this is some of the strategy for us, because for us this is dealing with COVID is not only dealing with the health issues, but also we got to take pay attention to the social and economic issues. I think that's what I can say. I hope it can give some inspiration for other. Thank you very much.
Many thanks, Dr. Ida, for your presentations. Most of members of Kesepuhan Cipta Gelar indigenous community work as farmer and selling some of agricultural products to urban areas. With the spread of COVID-19 pandemic, which paralyzed economic activities in urban areas, and also some community members in Kesepuhan Cipta Gelar were among the vulnerable group affected by socio-economic impact in long term caring and rehabilitations handling COVID-19 pandemic case. So we are going to the next sessions. For the next session is Q&A, question and answer. We have selected some question for all of our guest speaker. For the first one, for Dr. Imron Sosan. Dr. Imron Sosan, are you still there?
Yes. Yeah, I'm listening.
Please don't get sleepy.
Thank you, Dr. Ida.
Okay, Dr. Imron Sosan. For the first questions, you have 5 until 10 minutes for answering this question. For the first one is, what role can civil societies, people, organizations play to assist people in need in rural communities during the turmoil of COVID-19 in Thailand? And the second one, in your opinion, how do you think that Asian socio-cultural communities is perhaps the most essential community to bring resilience and solidarity for Asian people, Thai people? Okay, that's only 2 questions for you.
Thank you so much. Let me share something.
Yeah.
You see my presentation?
Okay.
Yes. The first question that you asking me now. Okay. This is my main presentation, I have touched many things to be related to the question. And what I would say that is at the end of the day, civil society or people organization or even because now our society, our community now leading into the new era of how to connect or how to work together as people, as individually, collectively, and whatever. We have to find an amicable way in order to sustain our society and our community, particularly in rural areas, particularly in rural communities. But now rural communities are now becoming into urban, or urbanization is affecting our rural communities that we are now living. But it is important to think about the rules and the measurement, or the what is called the possibility of those organizations in community. We have to empower them in order to make sure that our community are sustainable, and our children, our younger generation have a space to think, to talk, and to discuss about their future. Because now all community are no longer the same community as usual as ever before. That's the challenge. And also the second question, the second one, I would like to show you something. This is my research data from the field. I'm sorry I don't provide you the whole data of Thailand, COVID-19 of in Thailand. You can see and you can search the data, how many cases and whatever, or even government doing their measures, their policy and whatever. But now what I am doing is about the community level, the local level, in order to deal with the challenging pandemic now. ASEAN socio-cultural dimension is now at stake, is critical. I asked many people on the in the field, on the ground. Yes, they said that they knew ASEAN, they heard about ASEAN, but they didn't know what does it mean. ASEAN doesn't mean. They didn't know about that. But I cannot. I don't say that everybody nobody knows ASEAN, but I think ASEAN they know, but they don't know what ASEAN is doing for them. Definitely ASEAN has a lot of work, many meetings, every day meeting, every year's meeting, a lot of meeting, 1,000 meeting I heard. And in the past, ASEAN managed financial crisis well. They recognize that. But now, from now on, my research conclude that ASEAN must be scientific-driven community. We have to get a lot of, we have to get the truth about what we are now doing, even scientific, even data, scientific-based data, whatever. That's ASEAN must drive into the future. And also ASEAN must rethink or reconsider upon achievement in the past and look beyond and look at themselves, what potentially capacity that we have in order to move the region forward. But as I said earlier, it seemed to be that each member of ASEAN is working by its own way. But now, not only ASEAN, even UN, even multilateral, what you call international organization are now, you know, facing their own capacity or their own capacity, and even their own what you call their own way, because you don't, you know, you have to remember that ASEAN, even ASEAN, UN or regional organization, because of the donation by the members. But now every member has its own problems. Now sovereignty is what you call is squeezed, you know, by the pandemic. We have to take care of our own problems. That's the challenging. That's I think ASEAN is now at the crossroads. Yes, people from the field ask me as a lecturer, said, okay, Achan, in Thailand we call Achan as a lecturer at university. I think Rizky is familiar with this. Yes, ASEAN. Where is ASEAN? Where is ASEAN? I mean that they didn't see, you know, what ASEAN done for them. Even ASEAN done a lot of things. Okay, but now environmental issue, climate change, water crisis, droughts must be at the heart of ASEAN policy implementation. That's socio-cultural dimension. Because if we lose this dimension, and economic security will be in crisis, will be in trouble. But now people participation in every step is key in order to move ASEAN socio-cultural dimension forward, because socio-cultural dimension is, for me, means people participation, mean devolution, because now people need devolution from the government. They want to empower themselves to get involved in ASEAN activity. Yes, particularly people in rural areas need more participatory engagement. Now, what we are thinking, ASEAN must rethinking to be a people-centered ASEAN organization. That's, and last but not least, I can summarize. COVID-19 is our common challenge and destiny. We can't deny COVID-19. I couldn't say COVID-19 is good, as I said earlier, as I mentioned, but COVID-19 is a sign, is a critical sign for us as ASEAN people, in order to rethink what we have done before, in order to rethink what would we are going ahead, or what we are doing as humans, as human being, as country, as individual, in order to cope with this challenging moment. What we as ASEAN people should do is to work to share all data. That I'm glad today I heard a lot of the data from our speakers, from Malaysia, from Indonesia, but now we have to share more all data, experiences, kindness, failures, success with each other, with one another. If we success, if each of us success, ASEAN would be successful too. But this is the some data I have collected from the field. It is not complete, but that's those data I have presented today. I can say that at least this is the feeling, this is the real world that the people are facing. Yes, we talk about GDP. Yes, we talk about the growth, economic growth, whatever. But people on rural area, they are the first hand, we are the first victim of the crisis. But now we have to think, or we have to reconsider what we are now doing as much as we can do. Yeah, thank you so much.
Thank you so much, Dr. Imran. And the next speaker, we are going to give 2 questions also. Are you there, Miss Wanamiza?
Yes, I'm here.
Okay, Miss. Okay, the first question is how the strategy of the Malaysian government can eliminate the anxiety of the village community about COVID-19 so that the community remains productive and the community economic remains stable. The question from Putri dari Universitas Lambung Mangkurat. And the second question, as we all know, rural people have some habit about communal work to optimize their rural areas. But during pandemic, people should do physical distancing. And the question, is there any possible way to advance the people rural areas without communal work? The question from Alvin Agisna, Universitas Diponegoro, Semarang. Okay, time is yours, Miss.
All right, thank you, Putri, is it, from the first question? Okay, how can the strategies eliminate the anxiety of the people? I think even without COVID, the rural people has their own anxiety, and as long as COVID is still around, I don't think any government or anyone can erase or eliminate totally the anxiety of the people. But what we can do is to slowly make it reduce the anxiety, to make sure the government can make sure that their lives are not too disrupted, and that they can live, they don't live in fear all the time. They have the basic Maslow, they have their homes, they have their families, they have their food and basic necessities. So as long as that is, the needs are fulfilled, that should be good. Yeah. All right. Question number 2, communal work. All right. I think in Malaysia, we reduce a lot of communal work. The government has imposed a lot of standard operating procedures. So for example, weddings, we do online akad nikah. We limit the number of attendees for a wedding, and we have policemen that comes to check on events, and all events must have MySejahtera QR code, and everyone attending this the session must check in so that we know who comes for the wedding. And it has happened, I think last month, when one wedding, one guest is confirmed positive a week after he attended the wedding. So the entire invitees for the wedding have to be checked. Okay. Another strategy that the government has imposed to limit communal work, say for example, the festival Hari Raya and Hari Raya Haji, they limit for one household no more than 20 people coming in to visit. And I believe a lot of Malaysians abide by the restrictions or the SOP imposed by the government. So it actually helps because we don't want, and everybody has the awareness that you never know if you are bringing the virus. So especially don't go and see your old folks. You can talk to them every day. You can call them. You can video call them. And we have now parents who can talk to you on Google Meet or Zoom, but not actually salam, having physical contact. And yeah, that's the way it is. And I think a lot of people realize that, and it will only end once COVID is totally eradicated. Thank you.
Okay, thank you so much for the answer, Dr. Wan Hamiza. And the next speaker will also get 2 questions. Dr. Ida Widyaningsih, for the first question, how do preserve the Kesepuhan Cipta Gelar customary customs so that they are sustainable, but the rules of youth and women still have freedom in their careers? From Aldi UGM. And the second one, is there an effective way to manage natural resources and human resources in Kesepuhan Cipta Gelar village so that young farmer and women can compete with a global competition? From Andi Ahmad Dahlan University.
Okay, thank you very much for interesting and critical questions. The first question asking how how we can ensure that the approach is actually sustainable and even though and we can preserve the culture. So development is something that actually means contradictory ideas to some of government and the community. In some way, development actually encourages infrastructure development, for example, and also making people changing the way they live. But what is interesting in Cipta Gelar is very different with other areas in Indonesia. Our work also actually inspired by the thoughts that actually we know that in Cipta Gelar there are some new legal and illegal gold mining areas very close to the indigenous community, and then we think that we have to act to protect them. And in one way, because they are very decent people, but sometimes the pressures from modernization and development make them also forced into some of them actually also interested and involved in gold mining activities. And then we talk with the elderly how actually that kind of activities could destroy the forest and environment. And then most of the youth stop working in that mining, and then instead they start to discuss and work closer with the elderly. So Cipta Gelar is, as I said before, is different. They people there, if you come to the Cipta Gelar, you couldn't wear the clothes like the way you do. So if you come there, you have to respect them by wearing similar outfit with them. When I conducted my research, I was also wearing the same clothes with them because we couldn't go around in the village without respecting their culture. So Cipta Gelar, so we try to work very carefully with them. We try to understand their custom, their way of life, when we introduce new ideas, for example, we support them to establish their own TV station, because of the remoteness of their area, they couldn't have access to Indonesian TV station. Instead, they have access to international TV station using the parabola. So it is very dangerous because they can have access restricted information. So this is why we talk to the elderly, and then we also try to make them understand that it is probably easier for them to create their own content. So one of our work is actually supporting, giving them training how to make a local video, local TV, and local content. So we try to preserve their culture based on their local knowledge. So in Cipta Gelar, they have what they call as Sigat TV, Cipta Gelar TV, that actually distribute among the household. And the content of the program actually created by youth, women, and some children, primary school children. So one of our team stay in the village and also invited two others lecturers to stay in the village for about 4 months, and they created some local content and teaching youth and some primary school student to make their own movie and make it available on the TV. And another one is about the effectiveness to protect the environment. Actually, you know, I feel so embarrassed and so I mean that it's been kind of 30 years. I learned about development approach. I learned about participatory approach in development, community development, and so forth. But when I came to Cipta Gelar, I just realized that actually they've been talking about that. Not only talking, they have been practicing the community development and sustainable development approach since 16th century. So, for example, the way they protected their forests, they have a very interesting landscape of the village. They have an area called sacred forest, and then productive forest. So they divided into 3 different area of forest. You are not allowed to even take any leaves from a sacred forest. So they protected. And then when we conducted participatory mapping in that area, the sacred forest mean actually the place where they have water. So in Cipta Gelar, I think that's why we decided to keep working with them, because I think that the last Sundanese culture that actually has a very meaningful cultural system that implementing sustainable development principle. So we just talked about SDGs agendas recently, but they have been practicing it for more than 300 years. Yeah. So I think that's what I can say. I hope it can answer your question. Thank you.
Thank you so much for the answer, Dr. Ida Widyaningsih. So thanks for the answer and wonderful discussion from 3 speakers, Dr. Ida Widyaningsih, Dr. Wan Hamizah, and also Dr. Imron Sosan. And we are going to the next session to minimize the time. So let's jump straight to the second session. For the second session, we have the fourth speaker. The fourth speaker. Wait, just a moment. Okay, the fourth speaker is Dr. Christoph Behrens. Dr. Christoph Behrens got MA from Technical University Braunschweig, Germany, and he got Dr. Pil Christian Albrecht University, Kiel, Germany, and visiting professor for public management and politics at several universities in Southeast Asia, and also consultant to the Indonesian government and the Asian Interparliamentary Assembly on organizational and politic reform 2006 until 2014, and currently serving as a senior advisor to the Prime Minister of the State of Schleswig-Holstein, Germany, and a current research focus on disruption and their implications for political system. So please welcome Dr. Christoph Behrens. Dr. Christoph Behrens,
Yeah, can you hear me?
Yeah.
Yeah, unfortunately, I have a problem with the camera. So this is why you cannot see me right now. I will try from time to time to get online with the camera again, but I hope it will work like this as well.
I need to see your face because long time I never see you anymore.
Yeah, you have a photo of me. Maybe you can put the photo online that people have an idea how I look. Okay, I will start anyway because we have limited time, and I hope that's okay for you, even without seeing the video screen here. Thank you for the invitation to speak and to discuss with you today some aspects of what is, from my point of view, the biggest challenge for human civilization at the moment. And I want to broaden the perspective a bit at the beginning, because this challenge, from my point of view, is not only Corona and the current pandemic situation due to the outbreak of COVID-19. We have actually seen such a natural disaster before. And maybe you remember the HIV crisis, which started in the 1980s. It keeps us busy until today. Neither a cure nor a vaccination against HIV has been developed so far. We are still containing it only. And this HIV crisis was in many ways, from my point of view, a precursor to what we face today. A disaster that is not limited to a certain region or to a definable number of people, a disaster that affects various dimensions of human existence at the same time: our health, our social life, our economic fundament, and all aspects of our daily routines. It is a disaster that has a start, but likely won't end. And it is a disaster that has the potential to alter permanently the conditions of our very existence. All of this applies to our current encounter with COVID-19, and this makes the current situation so different and so new. It is unlike other disasters we experience, we learn to deal with, like earthquakes or floodings or landslides, volcano eruptions, and so on, because all of them have a limited impact and we have capacity already to handle it. We are prepared. And COVID-19, in contrast, is a global disruption, both for individuals and for systems, and it meets societies that are widely unprepared. It is a disaster that requires our permanent attention and full concentration, our creativity to deal continuously with new issues. So this disaster is not static, not clear to decode, and so we cannot simply activate some standard procedures we have developed, trained, and internalized already. It is dynamic instead and confronts us with new situations every day. And this causes chronic stress to excessive demand for many, psychologically and physically. It is an event that requires from us to change very fundamental things in a very short time: the way we organize our daily life, our societies, our economies, the way we interact, and even our self-perception as a human being. This is what I mean when I talk about the disruptive character of the current situation. The impact of the event is potentially all-encompassing. We likely will never have again the life we had before. And this new level of disaster leads to new challenges for a policy that targets to build resilience. This is, from my point of view, the real challenge we are facing. We need to adjust ourselves to confront and to master disruptions that have the potential to alter our human civilization as we know it. And COVID-19 is one of them, but others are already imminent. The climate crisis, global migration, the crisis of our economic global order. They are also interconnected. They overlap and reinforce each other. We heard some examples for that already from the speakers before. They have multi-dimensional impact. None of them can be faced or contained by a national state alone. So it is important to reflect about COVID-19, about social distancing, masks, about a future vaccination. But beyond that, we need to learn how to deal with disruptions. We have to build resilience against life-changing events. Our systems, political system, economic, social system, our communities and our individuals have to overcome previous perspectives. With a view on German experiences, let me have a look on three things very briefly. First, I want to sketch the political approach that from my point of view is suitable, and from my experience also. So it's not a theoretical approach, it is based on the practical implementation we are doing right now, a political approach to face a complex challenge. And I will highlight then some key aspects from this concrete action which are relevant particularly on local and regional level and for rural communities. If you want to say so, the success factors on the way to build sustainable resilience. And finally, maybe in the Q&A, I would love to discuss with you in an outlook possible scenarios how our life after Corona may look like. Please ask questions about details if you are interested in after my input, and you are invited as well to contact me personally via social media. You find me on Instagram, on Facebook, on LinkedIn, and of course in my office in Berlin. I will try now to open some slides. Also doesn't work. I'm sorry, the camera is completely offline. And you have to just listen to me. Sorry for that. So let's have a look on the political approach that is taken here in Germany and which is, from my experience so far, suitable to face a complex challenge like COVID-19. Maybe you, the one or the other of you, still remembers a globally discussed and often cited article published in March 2020 by Thomas Pueyo. The title was Coronavirus, the Hammer and the Dance. You will find it on the web if you Google hammer and dance. The text describes a flexible response to the threat by COVID-19 in 2 steps. First, a very strict containment approach at the beginning for a couple of weeks, and this then followed by a flexible response to local situations in order to avoid further infection waves until a vaccination has been developed. Germany, as well as many other European countries, have more or less followed this approach. We are targeting local hotspots, isolating infected persons, following up their social contacts in order to prevent new super spreading events and to avoid a breakdown of our national healthcare systems. Because Germany was very quick in these actions, it has reached a better result until now than others. This is the recent assessment on effectiveness by Christian Drosten, the chief virologist at Berlin's Charité Hospital and one of the scientific advisors of our government. For a very tight monitoring of current developments, solid data is necessary, and this data is coming from a high number of tests. We had a testing number of around 250,000 per week at the beginning, and currently Germany is conducting more than 1 million tests per week. And with this approach, Germany has a strong focus on particularly problematic local settings. Such problematic settings have been, for example, people returning from their summer holidays, bringing in new infections, fresh infections. These are also local outbreaks, for example, due to private festivities. Or we had a couple of weeks ago a case in a local factory where an effective hygiene management within the production process had not been installed yet. So in summary, a quick response, a differentiated response, not one solution fits all, with a strong local focus and a qualified response. This strategy requires, of course, to avoid what we see nowadays in other states somewhere, under-complex and one-dimensional views. It requires resourceful actors, of course, on various fields, who combine their perspectives and integrate the various dimensions of impact of the challenge of COVID-19 into a balanced approach. To monitor and assess the local situation, we need local authorities with sufficient capacity to provide the data and to follow up infections well embedded into local structures. We need a strong dialogue with the people, of course. We need well-established research institutions who can provide proper assessment as basis for political decisions. And on the national level, we need a government that has a clear idea about its coordinating function, a strong focus on professional communication between the different actors as well as with the whole population. What you see here is a combination of a bottom-up approach and a complementing top-down structure. During my time in Indonesia, around 10 years ago, my team and I have developed a model for such a concept that understands governance as a cooperation of many actors, not only as the acting of the government, and good governance as a successful cooperation in such a cooperative setting. We called this model complexity governance, and in the article which I will contribute for the publication of this webinar, I will go more into detail about it. Now, let's have a brief look at the outcome and success factors so far for Germany. Let me just mention a few key aspects. The German government clearly states facts. It's limiting itself to stating facts. It expects and suggests concrete contributions of everyone to limit the impact of the pandemic. The government is recommending, but asks people to act self-responsible. Strong restrictive measures are the exception. For example, traveling in Europe is still possible, it is still allowed. It is the self-responsible decision of people if they travel or not. The borders are open. But of course, when they travel to risk areas and come back to Germany, they have to do testing and, if necessary, quarantine. And this concept so far works well. Second, COVID-19 has not led to an existence-threatening economic crisis for the population or a social crisis. The social and economic dimensions of this disruptive event, COVID-19, are part of all considerations at all times. Not only the perspective of avoiding infections, also the social and economic dimensions, the impact. And our focus there is on the concrete life of the people. Infections rate, this is number 3, and the number of casualties in Germany are low. The healthcare system has managed the pandemic so far well. I give you one number there only. We have currently around 2,000 new infections per day, per day, 2,000 per day. France, our neighbor, has currently 14,000 new infections per day. And the countries which are on the top of the list globally, like the United States, India, Brazil, are facing between 50,000 and 80,000 new infections per day. This is quite a different dimension. Number 4, we have, of course, an ongoing lively discussion about what is necessary, and critical comment or even dissent to the government advice and decisions is not only legitimate in a democratic state, but to contribute and to criticize is an important aspect of our communication process about COVID-19, which is, from our point of view, a mutual learning process. Everyone is learning, also the government. And the recommendations we give today are not the same we gave 3 months ago. Maybe you have seen on the media a short time ago pictures of large demonstrations in Berlin, opponents of the government policy. They caused a wide echo in the media around the world, and some were asking, how is it possible that in this time of COVID-19 you allow such big demonstrations? The answer is very simple, because this is the essence of democracy, that people have the opportunity to state their comments or even dissent. And of course, when they do it, they have to follow safety protocols which are defined by the government. The result of this is a high acceptance of government policy, and this approval rate is stable for Germany around 90%. 90% of the population is supporting the course of the government. Now, finally, how about the different areas, urban areas, rural areas? This is actually the focus of our webinar. In Germany, the infection rates are varying a lot if you look to different regions. And this situation is also changing continuously because of the dynamic of COVID-19. The starting point of raising infections are concrete social activities. I mentioned some before. If you have a big celebration like a wedding and you are not careful, then this is becoming the starting point for new infections. And so the risk in the respective region has a lot to do with local awareness, with the local social life and local culture. And these are the links actually for building up resilience. Overall, living in a rural area in Germany is not safer per se. It always depends on the concrete local situation, but it is also not connected to above average vulnerability. Germany's population in general benefits from a high level of education, regardless of the place where people live. So we don't have this gap we have in other countries between urban setting and a rural setting in terms of education. This is important, of course, to channel successfully information about COVID-19. But information also has to be delivered in a language different people understand. And so a communication concept must include cultural and psychological aspects, as well as very concrete suggestions what people can do to protect themselves. These suggestions must be applicable, not abstract, in order to gain acceptance. And I want to illustrate this with one example. A big issue in Germany for quite a time was the closing of our schools. People had to go into homeschooling. And where COVID-19 does not allow to run a school because of the development of the pandemic, to run a school as usual, then the possibilities for successful homeschooling are directly connected with access to computer and internet. And here rural areas are clearly still disadvantaged, also in Germany. So the actual crisis has given a push to ensure that everyone, regardless of the place where he or she lives, is getting access to the digital world. COVID-19 has sensibilized for problematic aspects of globalization in the economic sector. We are discussing very focused at the moment in Germany regional potentials, because where production chains have been interrupted due to the pandemic, the view for local alternatives has been sharpened. In the tourism sector, regions like in Schleswig-Holstein, the state I work for, have started to create innovative ideas for alternatives to traveling abroad. These are just some examples because of the limited time. My time is actually over already. I'm at the end of my input, and I want to invite you to share some thoughts about future scenarios, about possible outcomes of the crisis, the post-corona world, so to say. Some of the previous speakers were at that point already, and I think we can and we should start this discussion today, because it is important to see how our societies will look in the future. I would like to invite you already today also for next year, for 2021, as Mas Rizky mentioned already. I am working also with colleagues in a research network with the name Future Indonesia, and we are reflecting current developments, discuss ideas and scenarios for the future of my second home country, which is Indonesia. And some of the questions of our webinar today will be further discussed on our symposium as a virtual event as well in May 2021. You are invited to join and to share your insight and thoughts. And finally, my thanks to the organizers and supporters of today's event. I'm looking forward to continue our discussion on another occasion, and hopefully soon again also personally in Bengkulu maybe, or in another location in Southeast Asia. Thank you.
thank you so much for your presentation, Dr. Christoph Behrens, about COVID-19 as disrupting events and as a social political challenge with a view on German experience and outline political approach that is suitable to face such as a complex challenge as well as identify specific key as a local and regional level in order to support sustainable resilience and give us an outlook into possible futures, our life after COVID-19's impact. So we are going, the last speaker, we call it Dr. Alexander. Dr. Alexander is a lecturer LD2 Dikti being assigned in University Professor Dr. Hazairin since 2005 and got master degree in the year of 2011 at Public Administrations Department of Sriwijaya University and Doctor of Public Administration from Pajajaran University is obtained in the year of 2019 and research interests focus on health policy, dynamic bureaucracy, and Asian study. So please welcome and take it your time, Dr. Alexander.
Thank you very much, Adinda Rizky Ananda, moderator. Before I begin this discussion, allow me to share my slide. Okay. And I remind the moderator to warn me if 5 minutes before the limit time for my presentation. Okay, allow me to deliver my slide. Okay. Is that clear enough, Mr. Moderator, Adinda Rizky?
Just a moment. Still ongoing.
Okay.
Okay.
Right. Okay. Okay, we can go on. All right. Thank you very much for the chance given to me to deliver the material. Before I start to deliver my material, allow me to introduce myself. I'm Alexander. I'm a lecturer of the Faculty of Social and Politics. And before I started this presentation, allow me to deliver my acknowledgement, my gratitude for organizer, committee, participant, speaker of this webinar and conference. So it is a great pleasure for me for being able to be a part of this webinar. My acknowledgement is also contributed for Rector Unihas Bengkulu, my honorable rector, Dr. Engineer Julfi Faris, our beloved Dean, Mrs. Harmiati, and then other committee who support this program. And I also would like to send my gratitude to my alma mater, Sriwijaya University and Pajajaran University, and also for our seniors, college, friends, and juniors, and also my beloved family. All right, before I started to present my material, my presentation, my slide, I'm going to deliver the structure or the outline of my presentation. First, it is going to discuss about where does the poverty lie on, why does it happen? And second, I'm going to discuss about our framework. And third, the implementation. And the last is optimization or reflection for improvement as the final statement of this presentation. Before I started my presentation, I took theme increasing rural capacity governance based on system thinking approach. As you know, that a little hard for me to find a crack because the previous speakers has delivered multi-perspective discourse, so that I have to tweak the material slightly, so that I think it's going to contribute well in our next discussion. Okay, ladies and gentlemen, this is okay. Before I start further, I'm going to start from this statement, from this data. Where does the poverty lie on? Actually, allow me to read the first table, and it's about the poverty in Bengkulu province. If we talk about the poverty in Bengkulu, in 2015, the highest number of poor people in Seluma Regency reached 22.98%. In 2016, namely 21.68%. And then while 270, it increased to 20.70%, and the latest date we got, 218, it decreased to 19%. While the second poorest population was in Kau Regency. The proportions of poor people in 2019, it reached 22.87%. In 2019, it was 22.37%. In 2017, it reached 21.54%, and it decreased to 19.4% in 2018. Okay, and then if we see another table in our second table, we can see that North Bengkulu Regency received the largest village fund with the amount of 231 more billions for 4 years from 2015 to 2018. The district that received the second largest village fund was Seluma Regency. Seluma Regency with the amount of 424 billions, more than 400. The district that received the third largest village fund was Kabupaten Rejang Lebong. Here you can see Rejang Lebong with a total of 370 billions more, whereas the district that received the smallest village fund was Lebong district, only receiving village fund around 2023 billions from 2015 to 2018. The district that received the second smallest village was Kepayang Regency with amount of 249 more billions. And the Regency which received the third smallest village fund was Bengkulu Tengah Regency, which around to 329 billions more. Ladies and gentlemen, what we can compare with this data is the increasing village allocations years by years. And then if we mix to the scatter plot here, we can read, what we can read is the scatter plot shows that the decline of poverty does not relate with the rate of increasing number village allocations fund. So it means that poverty reduction does not correlate with the provisions of village fund in all districts of Bengkulu province. The provisions of village fund is aimed at equitable development, economic improvement, and welfare of rural community, has not been optimal. The village fund should be able to stimulate the contribute to reducing the poverty. This is our assumption from the data we can conclude. So what happened then? Okay. What did happen? That's the questions that we are going to answer. First, what we can have for the final information is process of planning. We can see self-interest oriented happen, accepting opinions from prominent people rather than ordinary people happen, prioritizing financial gain happen, and being formalistic rather than dealing with actual problems happen in the process of planning in public institutions in rural area. And then second, also the development is not right on target. There is misoriented, there is misleading, there is miscoordinations happen there. And the third, the project of village infrastructure development has not fully employed manpower from the village. So the people come from the people there working there are from outside the village. And then the fourth, we talk about what does it happen in a rural area. We see social and cultural problem. We see silo mentality there, fragmented social life there, political intervention and social conflict. So for those things happen and influence the characteristics of institutions there. And then after we build some hypotheses in it, we conclude that our framework is a planning problem, participation problem, network problem, psychosocial problem happens there. So we, after several discussions in our devotions on a community as a lecture, we build some models to build some bottom-up problem-solving models, and then system thinking or real-time and dynamic thinking there. And ladies and gentlemen, before I explain what we've done here, I think we have to discuss what is the bottom-up model developing concept we are producing. The bottom-up is not driven by power and resources, but by problem and what is most likely to solve it. The analysis is continued by looking for what factors and resources were mobilized to influence the implementation and consequences of this implementation. The concrete step or back mapping are translated then into the various steps. They are first determine the structure and the process of implementing the policy, and then we describe concrete behavior that require policy intervention, and third, arrange organizational work steps that can be taken to influence behavior. Four, we describe the expected result for each step and describe the result of this step for each level of management. Ladies and gentlemen, for system dynamic approach we are applying is we develop system dynamic in a way of thinking that aims to study and understand change and complexity in a system through dynamic study on the effect and causes phenomena occurring from time to time. We then translate it into several models, and then we apply it in a workshop. And it includes first forest thinking. It is to see the big picture and relationship between elements in the system. And then dynamic thinking, it's a concern with recognizing the world as not static and change are constant. Third, we are developing how to think operational thinking to understand how something happened and how it is related to one another. And then the last, we drill the way of thinking of causal loop thinking, which recognize the cause and effect are not always linear, and each effect factor can be the cause dash factor. So those two approaches we develop as the way we improve or carry out some workshop for the people in rural area. This is the implementations, what we've done. We have done training on rural apparatus of Kedurang districts. It includes 9 villages of Bengkulu Selatan Regency course. The course we developed is first bottom-up model. It's about how to analyze problem with backward mapping, and then Cisco 2.0 applications, and we also developed a system thinking approach. And then after that, we also increasing apparatus capacity in Pondok Kubang in the workshop. Few villages are in our and then Bengkulu Tengah Regency courses, and the courses we deliver is first regulation, system thinking, bottom-up model, and others. Okay, ladies and gentlemen, in other places such as Lebong Regency, we also develop Sekolah Perangkat Desa or School for Rural Apparatus in Lebong Regency. There we develop some course on regulation, on system thinking, bottom-up model, and we got a lot of participants there. So the apparatus joined that freely, and then we carry out by system thinking, bottom-up model, regulations, and others. Okay, before I started to the final session, I'm going to jump first about what happened in our time. You know, when the outbreak hit, Bengkulu province is included to the area where the virus infected. And then day by day, it rise sharply. And until now, Bengkulu city actually rise total case today 590, with recovers 379, with the death in amount of 32. So this is the date of September 26. And then what happened in the rural area, or the place where we implement our workshop. So what we can deliver you, fortunately, after the process of workshop, they respond it very fast to reallocating budget to combat the pandemic. So the villages where we implement the workshop is doing this program, socializing the COVID-19 protocol. They are doing disinfectant spraying and mask allocating. They are doing social security network and BLT. Tracking and quarantine are also done by them. Ladies and gentlemen, what I can express to you is this is the result of our devotions to community. When we examine by a little research, we see that working attendance from the apparatus we have delivered the model of system thinking and backward mapping work with more diligence. They come to work with attendance increasing 24.15% before training. And then second, we see the willingness to study independently. We examine the perception with the Likert scale more than 3.8. And then after that, we can see, this is by the perceptions or public perceptions, a decreasing working delay and working deny with Likert scale 4.0. So we can assume from our devotion that to approach backward mapping and system thinking are good for them to increase the capacity building. But as the reflections for improvement, a detailed and comprehensive research on structural model that can describe and explain the critical items to improve the model must be done. And the second, improve the model design on each core of course and enrich them with more practical simulation is necessarily needed. And the last, to continue their spirit of working, their spirit of devotion, we have to keep on motivating the rural apparatus with more appreciation and the proper compensation. I think it is here all what I can present as my slides, and I'm sure that more discussion will enrich our discussions today. I return to Mr. Moderator Adinda Rizky. Thank you very much.
Thank you so much for your presentations, Dr. Alexander, about the village has extraordinary resource to create prosperity in the era of free competitions. So that to be able to compete, it's necessary to build creative effort and also working attendance, the first point, and the second one, willingness to study independently, and the third one is decrease working delay. And we are going to the next sessions. The next sessions, question and answer. For the first question for Dr. Christoph Behrens. Are you still there, Doctor? Dr. Christoph Behrens?
I think his mic.
Can you hear me now?
Yeah.
Yeah, I could see you now.
Yeah, now you know it's me.
Okay, Dr. Christoph Behrens.
I'm sorry, I had to restart the system and now it's working.
Okay, you look so handsome, Doctor.
Oh, thank you. Sama-sama.
Okay, pertanyaan pertama, in Indonesia, Doctor, is it okay?
Yeah.
No, in bahasa. Okay, for the first question, as a large country, does German government have a policy in agriculture sector during pandemic? If such a policy existed, how would agriculture policy be implemented in Germany? The question from Heru Purnawan, Unihas University. And the second question, what are the solutions for Germany or European country in overcoming economic problems during the COVID-19 periods? The question from Evander Billy Johannes Emanuel Christian School. Only 2 questions, Dr.
Okay. Thank you for the questions. The first is quickly answered in the rural areas, in the area where agriculture takes place. The COVID measures are basically the same like elsewhere. So it is about ensuring protective measures. And of course, the framework is different there because the way work is done is different. About the economic impact, it is more, I would say, an impact when it comes to trade. over borders. The local production in Germany is quite huge, and we have, for example, large exports to Asian countries, to China, for example, to South Korea. And under these conditions, exports are becoming problematic sometimes. Yeah. So the point is actually that we come to global solutions, to global protocols, which allow to continue global economic interaction. And this is what we are working on in bilateral and multilateral talks. You know that the frame conditions are also changing a bit. Multilateralism is getting problematic more and more because some important countries like the United States are not supporting it basically anymore. And I found an interesting contribution by a think tank from Europe recently, who said, if you cannot go forward with multilateralism, then do it with minilateralism. Yeah, so cooperate with people who are willing to cooperate. And this is actually what we are trying to do in this field. The general question about economy is partially answered with this already as well. Europe is focused on global economy, export and import, organizing export and import. And so we are interested in continuing business models which are based on multilateralism and on a global economy. And when we have such a disruption like COVID-19, the challenge is basically to allow further international trade. And this is then for the benefit of everyone who is participating there. We have some specific sectors which are hit hard by COVID-19, and where these are sectors who have a perspective, who are not outdated, yeah, but providing products which are important also in the future, then the German government is supporting them and supporting companies to survive this crisis with direct support. And we have a strong discussion about business sectors where maybe there is no proper economic perspective anymore. And this debate in which cases the government should invest funds and support to help such parts of our economy is an ongoing discussion with new aspects of the discussion every day. So the situation is also there very volatile and requires new assessment and new decisions basically every day. So I cannot really say where we will be in terms of description of the future. How will the European economy look like? My assumption is that the economic bloc European Union will continue to be a strong economic bloc, but that we will see maybe an increasing focus on economic activities within the European Union and a slight regress of economic activity with other parts of the world. But we will see. We hope for the best at least, because, you know, countries who have a lot have also to lose a lot. This is not only in Europe like this, also prosperous Asian nations have to lose a lot if global economy in the form we know it should not be possible anymore. Thank you.
Okay, thank you so much for the answer, Dr. Behrens. And
next time in Bahasa.
Okay, next Pak Alex.
Okay.
Okay, for Dr. Alex, we have two questions also. First, the first one, the results show the community's perception of the village policies and governance area oriented to personal interests, more accepting opinions from prominent people, prioritizing financial gains, and forgetting about being formalistic in dealing with actual problem. So
sorry, I cannot catch your sentences all. Can you repeat it? There's a little problem in my.
Okay. I'm going to repeat it. The results show the community's perceptions of the village policies and governance are oriented to personal interests, more accepting opinions from prominent people, prioritizing financial gains, and forgetting about being formalistic in dealing with actual problem. So what is the solution about that? The question from Ricky from Sriwijaya University. And the second question, what is the best solution so that the village community service could be village well to build the economic? And the question from Redu, Bengkulu University. Okay.
Thank you very much, Adinda Rizky. First question is about the former problem. Actually, there are many problems cannot be take well into the way of thinking. It is a silo problem, fragmented problem, or some other social and conflict problem. So it needs some new way of thinking, maybe systematic thinking, robust thinking, and actually taking some real picture in our reality to be the concept are very difficult. So our problem now is how to bring the problem into the real policy, and how to bring the policy into action, how to bring action into policy, into a real consistent work. So I do think that the honesty, the consistency of taking the problem to implement that with legal ways are needed. And then the base of those capacity is how to manage the resources, human resources system in our institution. So according to the idea of system thinking, model of backward mapping, is the capacity of improvement of one organization is how the resources, human resources, take the problem into the reflection, and the reflections are poured into the policy, and the policy is being implemented into action. So what we've done in a few activities, we developed some models on the way to develop their system of thinking, the way of developing the consistency of thinking, the way to be to take the reality picture to the frame of the policy. So in the terminology of application, it is truly what we can prove is mean something to improvement of policy or bureaucracy in rural bureaucracy. So the shortest way to take the social and cultural problem is to think about the system in robust thinking. So it is not easily being studied, but it needs consistency to do it into action. And then the second question is, what is the best solution to build economy in the rural area or in village? As we know that the village is sources of raw material, the sources of food security. So to maintain the sources means to build the economic resiliency, sustainability. So if we are talk about or we discuss about the best solution is collaborative governance. So deliberative, collaborative among the stakeholder, and then where we can gain or where we're going to be able to preserve some accountability policy, I think will be very important to build the sources of human capacity that will bring good policy, good public management, and then the rest, after that, we are going to have very increasing participation from public. Maybe all, Adinda Rizky, thank you very much.
Okay, you are welcome, Dr. Alexander. And we still have 5 speakers here. So the last statement, we need a last statement, only 2 minutes for each of you. What is the best solution based on you deliver to build rural resilience? Okay, Mr. Imran, Dr. Imran, are you still there? Only 2 minutes. What is the best solutions based on your deliver to build up the rural resilience? It's still unmute. Dr. Imran, it's still
Okay.
Okay.
Hello, hello.
Yeah.
Yes. Okay. Sorry, I muted my. First of all, I would like to summarize my understanding about COVID-19 threatening our community. Already, I think no one can deny COVID-19 already reveal our system. What we have hint in the system that we have already established. What I call secret things or whatever. We need to be more transparent. We need to be more accountable for whatever we are doing now. I think we have to think beyond our daily life, our routine job, or our what I would call what we have been familiar with. I think now we have to think about the alternative way of economy development. We have not just sorry, I am not a fan of GDP, but GDP can be acceptable for me. That's fine. But now the measure of economic development, I think we should find amicable solution, or we should find amicable way or alternative way or sustainable way in order to move our society sustainable, to move our society longer than our generation. But now I think COVID-19 has already driven, us in order to the era of we don't know. Because of the limitation of our knowledge. That is the time for us as ASEAN people, as humanity, to share together with with all element, all solution. There is no only solution for humanity now. We need collective solution for us. Okay. From Germany, from Indonesia, from those things. Now we need human solution, not country solution. We need human being solution. It's big. COVID-19 is bigger than this, but we are now being tested, not only COVID-19, but also the system we have created. Now we are the victim of the system we created. You know, some country now survive because of their own system, their own you know, economy, or their own sufficient, whatever, what you can say, sufficiency or whatever. But now, I think now it's time for us to look at our friends.
Okay, okay.
Our
Dr.
Yes.
Imran, time
Yes.
is up. Thank you so much for
Yeah, that's my solution. There is no one solution, absolutely.
Okay, thank you so much,
Yeah,
Dr. Imran. So the next speaker, the second speaker, Dr. Wanamiza, could you give us what is the best solutions based on your deliver to build resilience during COVID-19? Rural resilience during COVID-19.
Okay, thank you, Adinda Rizky. All right, as I was mentioned this morning, I propose the communication strategy from the government, and the best way to increase rural resilience is for the people to keep updating themselves on the information and knowledge regarding COVID and the environment. And when you talk about government policy, it does not necessarily comes only from the top government or from the federal government, but it filters down to the state government and also to the district government. But more importantly, all the policies or all the people that's been talking should speak only one language. And there's no, you couldn't have one person saying one thing and the other person saying another thing. And this contradictory statements would confuse the rural people. So that's my answer. Thank you.
Okay, thank you so much, Dr. Wanamiza. And the third speaker for Dr. Ida Widyaningsih still is here.
Yeah.
What is the best solution based on your deliver to build rural resilience?
Thank you very much for the opportunity. As I mentioned before, that actually COVID-19 is not only a health problem. So we should really consider other impacts and dimension, including economic, social, and politics. Therefore, when we want to address the issues, we should consider all multiple issues, and then also we should introduce or using a collaborative approach to address those issues using different language, different strategies in respect of the stakeholders. For example, when we work with local people, do not act that you are actually the one that actually know everything. Please work with them, use their language, and consider their knowledge and their need. And also, there is a need for all of us as an academic, as well as researchers and government, to listen more to the people and respect their space, because they also have their ideal of development. So I think that's the best way to address this issue, because sometimes we think rural people has no knowledge on everything, but actually they know, but sometimes they don't know that they are knowing something. Okay, thank you very much.
Thank you so much, Dr. Ida Widyaningsih. And the next speaker for Mr. Behrens, Dr. Behrens.
Yes, thank you. Can you hear me?
Yeah, I can hear you.
Yeah, okay.
The solutions.
I mean,
to build
if you see the statements, you realize that in a discussion like today, we are really close with our assessments and also suggestions what to do. And this is one of the lessons learned for me out of the current crisis situation, that international cooperation and exchange about challenges was never more necessary than now. And I think from my point of view, I tried to explain this also in my statement, COVID-19 is something like a test run for humanity if we can organize alternatives to ways we deal with things, we live so far. Yeah, this is economically, we need to do something to create more sustainability and not to kill our planet. We need cooperation to avoid spreading of diseases in a global society. And this is why I'm also talking about challenges for humanity, like other speakers do, and try to point out that there are no regional or national solutions without cooperation with others. But on the other side, of course, we have to look into the detail, and the regional situations are very diverse. And this means we have to check our systems if they are ready for future. Dr. Imran said the same, I think, more or less. We have to address, as Dr. Wan Amiza said, the self-responsibility of the people to inform themselves and to draw the right conclusions. And this is the main task, I think, of the government, of course, to empower people to deal with such crisis. And we have to see COVID-19 not as an isolated event, but in a bigger context. And this is why I try to show what dimension this current test run has. It is about disruptions that are affecting everyone and all parts of our lives. And yeah, I'm very keen actually to see if this, what we do today, is a one-time event, or we will meet again on different occasions to continue this discussion and work mutually on solutions. Yeah, if you are at that point and you re-invite for a next discussion, I'm in. Thank you and greetings from Germany.
Thank you so much, Dr. Beren, for your point. And the last speaker, Dr. Alexander, the same question for you.
Thank you very much, Bunda Rizky. Like the other speakers, we understand that COVID-19 is our common problem, and then the rural people, the people who inhabit in village, are very vulnerable. While in other dilemmatic problem, food security, raw material must be protected, and it lies in the village. So, like what Ms. Ida Vidyaningsih said, never think that they can do to think or to do what's the best for them. They understand and know how is to take the best for them. So I think collaborative, decentralized, and autonomy need to be implemented as the realization, not only as the legalization. While in the same position, the government, I mean the central government, has to give the clear position, give the strict legalization, what may not and what may, for the implementation of policy, especially in taking care of COVID pandemic. So I think one is the best thing to understand is we have to build together in one harmony, to work together in collaborative way to improve our better institution to handle our problem, and then to have to build a resilience in rural people. Maybe this is Adinda Rizky what I can deliver as the final statement. Thank you very much.
Okay, thank you very much to all of our guest speakers. And for everybody, let me convey the conclusions. The current pandemic conditions has affected rural conditions and is increasingly burdening rural communities. So the COVID pandemic has also contributed to increasingly poverty. Various concrete steps have been taken by Asian countries, one of which Indonesia and Malaysia also, and ranging from allocating social safety nets, funds, and to prevent poverty spike, such as non-cash financial assistance, non-cash food assistance, pre-employment, policy subsidized electricity, and including village funds. Then Thailand for rural Muslim organizations, the condition also of COVID-19 is a challenge to maintain their capacity strength. Besides, the Germany as a developed country also consider this incident too annoying and posing social and political challenge. Therefore, rural rebuilding measures and programs have only one goal. Only one goal is restore the economic and restore the economic national and rebuild rural resilience, which has an impact on the COVID-19 pandemic, especially rural Asian. So the last one, we would like to say thank you so much to all of our guest speakers. Thank you so much for coming and joining this seminar. Thank you so much, Dr. Alexander. Thank you so much, Dr. Behrens, Dr. Ida Widyaningsih, Dr. Imron Sosan, and also Dr. Wan Namiza. Thank you so much for coming and joining this seminar. And we would like to say thank you so much also to all of participants for coming and joining this seminar. And please do not forget, if you have leisure time, we are going to go to the next session, the next agenda. The next agenda is an international conference. We already have select from 15 writings, only two presenters, only two presents about paper, only two presenters. We select the best paper to present about their paper. So please do not forget, if you have leisure time, to join our international conference after this agenda is closed. And the last one, we would like to say thank you so much anymore to all of you, and see you later. I give it back to our MC. See you, Dr. Alexander, Dr. Behrens, Dr. Ida, Dr. Imran.
Thank you very much.
Okay, thank you, Rizky, for moderating the excellent seminar. Ladies and gentlemen, before the end this event in this agenda, we will hold a photo session to the rector, the dean, keynote speaker, as well all the participants are welcome to take a position. Once again, we will hold the photo session to the rector, the dean, keynote speaker, as well as participants are welcome to take a position. Okay, thank you. Well, Excellencies, participants, ladies and gentlemen, we have had a productive and inspiring time together. Thank you very much for the rector, the dean, the speakers, the moderator, and also to the participants for very active participation. I hope you have found a presentation on the seminar and conference are informative, helpful, and be able to see and influence our future. Finally, we come to the end of this event. To close this event, let's reciting Hamdalah. Alhamdulillah. I am Efsa Ulansuri as the Master of Ceremony today and the comedy of this program. Beg your pardon of the mistake that we have made. Till we meet again, perhaps in the next conference and seminar. May all of you have a safe journey home. Wassalamualaikum warahmatullahi wabarakatuh. Thank you very much.
Waalaikumsalam warahmatullahi wabarakatuh.
Good day, everyone. Okay, we are going to start 2 minutes later after all of presenter has prepared. Abhishek, brother, could you hear me, brother?
Hello, sir.
Okay.
This is Abhishek.
Yeah. Please prepare your PowerPoint first.
Yeah, sure, sir. My voice is audible, sir?
Okay. Just a moment. Just a minute, okay?
Yeah, my voice is audible, sir. Is it loud and clear?
Yeah.
Okay, thank you.
Clear.
Okay. Allow me to share my screen, sir.
Yeah.
Let me share my.
But please don't speak too fast. Okay.
Sir, sorry.
Okay.
Sorry,
Just
sir.
slowly, brother.
Sorry, I can't hear you, sir.
Please don't speak too fast. Please speak slowly, brother.
Yeah, sure, sir. Sure.
Okay. Don't speak. I'm sorry.
Screen is visible, sir.
Hello, everyone. Good day in the Indonesia time, and thank you for the time and opportunity once again for everyone. And we meet again in this opportunity, namely the conference sessions. In these sessions, we have selected only a few writings and are represented by several presenters. Meanwhile, we want to inform you that there are 14 writings, paper that have been submitted and have been collected to us to be as a proceedings, but only three speakers. Three speakers will present the paper. On these associations, we will give the presenter 10 minutes and will be followed by a question and the answer sessions, and the end of the sessions after all the presenter have made a presentations. So for the first ones, we call it Abhishek Pandey. Abhishek Pandey is from India, SGSVMV University, Kanchipuram. Okay. Brother,
thank you so much, sir. Sir, am I audible, sir? And is the screen is visible?
Yeah, we could see you.
And what about the screen, sir? Is it visible?
We could see your PowerPoint now.
Okay, thank you so much, sir.
Yes.
And this is Abhishek Pandey, a research scholar at SCSVM University, Kanchipuram. And first of all, I would like to say thanks to Rizki Ananda, sir, for giving this opportunity to present my insight on title Deep Learning Based Cloud Integrated Agriculture during this COVID-19. As abstract, as we all are facing across the world, we all are facing the same problem, and outbreak of this coronavirus in India and subsequent lockdown, unfortunately, also considered with the country's peak harvesting time of variety of crops of the season. Across India, there is a massive crisis of agriculture, and because of this pandemic, Indian farmers are facing so many problems in agriculture domain, such as irrigation infrastructure, market infrastructure, and transport infrastructure. What could be the possible solution? Because of this lockdown, an unprecedented global pandemic is hitting, especially this agriculture domain. Large gathering are not allowed. People are using social distancing when they are in public domain, and this virus is going to be long. The solution is not going to happen for one day. It may prolong. Therefore, what could be the possible solution? The solution, better solution is we need to apply ICT, especially in rural areas, where we should have a digital infrastructure that provides services to the farmer. In this framework, we promote a fast development agriculture modernization, realize smart agriculture, and effective solution to solve the problem concerning to the agriculture. Now, risk associated with agriculture during COVID-19. As the pandemic began, especially in India, the country was locked down in the beginning of March 23rd, and quarantine protocol being applied to different states. Because of this, disconnected logistic and transportation happen, and this leads a lack of agriculture inputs, storage, shortage of labor because of this lockdown, because physical movement was restricted, interrupted trade, unstable sales of product. This leads delay or postpone of agriculture production, and that cause food wastage and food insecurity and decline of income to the farmer, and that leads social instability in the rural areas. Now, the solution is a cloud computing role for promotion of agriculture. Cloud computing application in agriculture makes agriculture products do not need too much on hardware and software investments, do not need master advanced knowledge of computer and network technology. Just what they need to do, they need to register with a cloud provider who are providing agricultural services, and they can get all the solution related to the farming. Various researchers have done research in this area of cloud and IoT, application of IoT for building resilience, especially in rural areas, in agriculture domain, how the IoT and cloud computing can can boost the agriculture. That too, a country in which the economy of a country widely depend on agriculture. Now, problem statement. That we actually in this we want to develop a DSS, a decision support system, to make use of cloud computing technology and devices that come in handy to the all farmers. To the all farmers, where farmer can use this flexible knowledge, information sharing, local and global communication, the knowledge, global knowledge in the related area. Necessity of a proposed system in agriculture sector. Cloud computing technology is recently picking up a global market extensively, covering almost all prime sector and areas, but nothing to still done in Indian agro sector. A lot to be done because what we are facing, farmers are not that much digitally literate, and there is not that much digital infrastructure in rural India. The effective use of cloud and agro sector will bring positive change by utilizing cloud key features. And this COVID-19 has opened opportunity for adoption of digital agriculture solution in various functionalities related to agriculture. Necessities of proposed system in agriculture sector. Information management is easier and managed by service provider who are expert in the field and team of professionals. And technical issues, if it happened, that will be resolved remotely by the service providers. We are supposed to have a green land, green agriculture farm that is connected with various sensors related to like moisture sensor, water sensor, temperature sensor, and these sensor, we will collect these sensor information related to the farm, because farmer, especially because this situation may be prolonged, and what will be the future of agriculture, we need to think of. Therefore, farmer also can work from home. Farmer can also cultivate from home. Therefore, this data to be uploaded on cloud, and cloud at the internet, farmer can see their crop health, if a particular disease in a crop, what could be the possible solution. And this is the user interface, where a end user, a farmer, can connect with a laptop or mobile phone and communicate and connect with the server, for decision support. And what kind of facility a farmer can get over the digital cloud environment? Cloud related information, he can crop related information, he can access health of the crop related information over the medium, weather information, soil health information, decision making. Means the decision support system will provide decision support to the farmer. If a plant is having particular disease, what could be the solution to the particular problem? Growth progress monitoring, progress monitor, he can monitor it. Farmer data, he can see his data on internet. Expert consultation will be provided 24/7. This is the data flow, where we have to upload that data, and we divide this data into training and testing data sets and applied our TensorFlow data model. And we would like to see with this model how much this mean square error should come, and with the possible MSE, we will find whether the disease is whether a plant is infected by a particular disease or not. What are the benefits of this agriculture cloud? Agriculture cloud provides a 24/7 facility. No need to go physically to the farms, and it reduces the manpower, labor in effectiveness, and it reduces the cost, resource wastage also. Production enhancement, and lowered the operation cost, and ultimately it increase the profit. But there are few concerns. What are the concerns? We need to develop on cloud. Internet means a farmer who is not having digitally literate. First is we should have a digital infrastructure, where we should have ubiquitous 24/7 internet facility, where he can access the cloud. And another problem what is in this model is One of the main concern in cloud computing is the conflict of different country laws, and the nation may not be willing to share the sensitive information to the third party. The conclusion: an effective implementation of this model encourage other sectors even. This will bridge the gap between technology and the resilience in the rural development. Thank you so much, sir, for giving this opportunity. Thank you, sir. Rizki Ananda, sir, thanks a lot. Sir, Rizki Ananda, sir, I completed my presentation. If any question, I'll be happy to answer. Thank you, sir.
I could hear you. Sorry for inconvenience.
It's all right, no problem.
Okay. As the results that you conclude in problem in Indians agriculture, such as lack of irrigation infrastructure, market infrastructure, and transportation also infrastructure. And one solution that you mentioned that can be fixed is by using in deep cloud-based learning environments that helps gather information from farmer in this location. Okay, thank you.
Welcome,
I'm
sir.
Sheikh Pandey. We are going to the next speaker. The next speaker is Dr. Alexander. Dr. Alexander, could you hear me?
I'm sorry, Mr. Moderator, Mr. Rizky Ananda. I'm still fixing my audio and my video. It seems to me that I have problem with these instruments. So would you give me a little time to fix them up, and after that I'm going to report you.
In order to cope this situation.
Excuse me, Mr. Moderator. It seems to me that I cannot operate my video call. I assume that if you can allow me to just do a presentations without my video,
Okay.
is it allowed or not?
Okay, it's okay. It's not big deal. You can continue your presentations, Doctor.
Okay, thank you very much, Mr. Rizky Ananda. And then I'm so sorry for this presentation. We do have problem. Actually, I'm on my way to my office now because I have an activity, but I have to also present my material. So allow me to present my paper, and the paper is about the practical system thinking approach in strengthening village bottom-up model planning practice, paper article from my previous research. Thank you, Mr. Moderator. Allow me to present my material, my presentation. I'm going to support this after the problem being fixed, the what we call it slide. If we talk about the practical system thinking approach in strengthening village bottom-up model planning practice, the practice of village government policy and governance has two problems, the dilemma. Namely, it is how to understand the value of various community groups and the problems of malfunctioning village group political agreement. It's according to Bonstra, 2006. The result of research on community perception regarding village policy and governance are first oriented to personal interest. Second, more extending opinion from prominent people. Third, prioritizing financial benefit, and being formalistic in a nature that takes care of actual problem, according to Psych 2007. In fact, the challenge of village government today is to provide good public services and at the same time have confidence in central government. Okay, the key to improving village government policy and governance is how to leave the traditional public administration's approach toward a problem-based approach and making interjurisdictional decisions of public, private, and non-profit stakeholders. Several studies on village governance show that the importance collaborations between institutions and deliberation policies that will increase community participation. It is according to Winterton, Palkowski, Wellbrock, Cloak, and Wang. A deeper study from Pirro and Smith, 2008, regarding the development of village institutional credibility provide, they say that provide the expected village leadership recommendations. Namely, first, village leader must be able to function governance and policy as credible to users and stakeholders. Second, leaders are capable of and apply leadership that advance cooperation, collaboration, and coalition. For the interest of critical villages leaders in overcoming circumstance and mediating the interest of the community. It is according Beer 2014. Application of this framework is the leader's role as decision making. Understanding system thinking provide a true and dialectical understanding of the multi-agents involved in a problem. How at all system thinking, according to is able to manage the problem by making decisions quickly, rationally, and properly. Through system thinking, the silo and management mentality can be eroded so that the self-service, mobile service, and smart service will be realized as a challenge for disruptive era 4.0. The COVID-19 pandemic also carries the urgency, the need for heuristic and rational decision by public leaders, where the response of the government during the pandemic make appropriations clear and decentralized operational decision is very important to carry out the new normal era order. The concept of Industrial Revolution 4.0 originates from the idea of the German Federal Ministry of Education and Research regarding the 2020 Strategic Technology Project and the 3-company platform. It is according to Lassi et al. 2014. With accelerations of the process of the social, economic, and political change, which is manifested in the following areas, namely, first, has a high capacity for innovation speed, buyer determine the market, and third, flexibility in a production's development, and fourth, rapid decision making, organizational decentralization, fifth, efficiency of resources required. According to Gerikagoitia et al., the practice of 4.0 Industrial Revolution is related to the use of the Internet of Things, IoT, artificial intelligence, robotics, and the use of big data or cloud computing. Governance is influenced by Industrial Revolution 4.0 because the new dynamic and challenge create, and therefore the government must carry out the digital transformation to survive in the era of 4.0. regulations by the Minister of Administrative Reform and Bureaucratic Reform number 25 of 2020 concerning the bureaucratic reform roadmap 2020. And then we formulate the synthetic meta model on the frame of Kazantzeb et al. 218 as presented, and we adopt this frame of work that if we would like to maintain a good governance in rural area, so there are a few things to be managed. First, we talk about demand-driven collaboration, DDC. As a meta model of governance, it encourages collaborations roles between actors in meeting the need of public goods or services. This meta concept consists of documents relating to goal deadline, relating to boundary momentum, and syntax also explain the importance of decision-making mechanism by taking into account the preferences or ranking, majority aspect, and the pace of rule information.
Dr. Alexander, sorry for bothering you. You have 2 minutes left for our presentation.
Okay, thank you very much. A little conclusion. So, decision-making mechanism must be divided into ranking, majority, and instruction process, and it's going to influence the resource of power analysis. So governance meta rule is influenced by the process and the rule descriptions. There are all my presentations for this opportunity. Thank you very much, Mr. Rizky, for the time.
Okay, thank you so much for your presentations. And your presentation shows that communities' perceptions of village policies and government's area start from the more accepting opinion from prominent people, prioritizing financial gains and forgetting about being formalistic in dealing with actual problems and also oriented to personal interests. And the third speaker, we call it Gali Duriski Jailani. Gali Duriski Jailani, time is yours.
Hello everyone. Can you see me on the screen? And can you hear me?
Yeah, sure.
Okay. Now I would like to share my screen, my presentation. First of all, I would like to say thank you to all the committees and then the keynote speaker and then the participant of this webinar. Today, in the good day, I would like to present about my paper, which is collaborate with one of my friends in the Universitas Muhammadiyah. Now she is being the moderator. Our topic is talking about Indonesian government social policy in protecting vulnerable groups during the COVID-19 pandemic. So my name is Gali Duriski Jalani. Address me as Gali. I'm from the student of Rural Development Management Program in Khon Kaen University, Thailand. Now we jump to the content. So in here, the content are first I'm talking about the research method. Second one is the introduction. The third one is research focus. Fourth, result and discussion, and then the last is conclusion and recommendation. Now, as this method used for finding the research, this research use a qualitative approach to find in-depth information from related sources, like the law or regulation by the government, and then the literature review, news, and everything that related with the research. In that information about social policies is seen from the social programs carried carried out by the government regarding social security programs formulated by referring to Article 34 of 1945 Constitution and Law Number 40 of 2004 concerning the national social security system obtained by communities during the spread of the COVID-19 pandemic. As we may know that the case of the coronavirus now has been spread into all of the nation in the world. Like you can see now here in the screen, the coronavirus reached about 32 million people that got the cases, which is that about 900, and then the recovered people about 23. There is still left 7 million cases in the world. In case of Indonesia itself, we are now in the number 23 according to the World Matters website, which is our case is now 262,000, and then the total recovered about 191,000, and then the active cases still 60. So it's since the early of the 2020, our government has been enact and then release a lot of strategy to prevent the coronavirus, which is like all of the region have their own strategy to prevent the coronavirus by lock down their cities, lock down their province, like that. Until now, there is still some region like Jabodetabek area, and now it affect about the health, the social, and then the economical sector in Indonesia itself. About the economic things, the unemployment on to 2020. On February, there's have 6.88 million people have a job, doesn't have any job, which is about because of the COVID-19. It increased about 3.6 million people lost their job, which is up until now there is 10 million people that didn't get any job. It is according to the Central Statistic Agency of Indonesia, 2020. So this research method is talking about the social policy. One, as I mentioned here, one social policy. One is one of the public policy. Is a government decision made to respond to issue of a public nature, namely overcoming social problem or meeting the needs of the public at large. And then we are focusing here the vulnerable group, which is according to WHO, who are the vulnerable groups. First one is the pregnant women, children, people with special needs, and also the elderly, and then the last is breastfeeding mother. So a price and comprehensive social policy is needed so that social policy can be realized in three categories, namely legislation, social service program, and taxation system, according to Midley on 2000. Therefore, the study of social policy in more specific sense refers to social policy concerning the social welfare sector, and then the social development which aim to improve the quality and economy of the human life. So as we are highlight the three the three pillars of the paper, which is about the regulation. Here's the regulation or law or policy that has been issued by the Indonesian government. First is about the Article 34, like I mentioned before, the decree of the Ministry of Social Affairs, and then blah, 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 which is all of this regulation is as the best layer for concerning the next activity, what the government should do, or what's the strategy to overcome the coronavirus. The second one is about the social service program. In here, we are conclude that there is two social service program. First is the regular one, and then the second one is the non-regular one. So for the regular program, they have a Kartu Prakerja, which is pre-employment card. It start from this year, which is all of the jobless people in Indonesia can join and sign up of this Kartu Prakerja, and then if they got accepted, they will have a job training and then the incentive for 4 months, which is every month they will get 600,000. And then for the next one is the program Keluarga Harapan or Family Hope program, which is you may see here. All of the program have their own price, incentive. And then note that component assistance is provided for a maximum of 4 people in one family, which is this program will cover only 4 people in the family. And then the last is Kartu Sembako Murah, or we call or in English they call it cheap basic food card, which is at the first month in the early of this program, they are giving the people about 150,000 rupiah per month, and then because this COVID, they are increased 50,000 rupiah, so it's 200. And then they can buy this cheap basic food card from eWarung, which is it's like a platform, and then the application from the corporate agency with the government. And then the non-regular program, which is there is a bantuan sosial berupa paket sembako, or we call it basic food social assistant for the Jabodetabek area. Jabodetabek area is like Jakarta, Bogor, Depok, Tangerang, and Bekasi. So it's the DKI Jakarta area. So in this program, they are trying to distribute about 1.2 million head of the family, start from April until June on 2000. The basic food package provide are worth 600. Like the basic food they need, like the oil, the rice, milk, cornet, or any other thing. And then the second one is cash social assistant for the Jabodetabek area, which is outside the area of Jakarta, Bogor, Depok, Tangerang, and Bekasi, which is it's targeted about 9 million people. And then up until now, only reached about 5 million people got reached of the aid. And then they will extend the time until December of this year. And then the third one is electricity fee waiver, which is they have 2 types. First, for the household that consume about 450 volt amperes, they will get a free charge of the waiver, the electricity fee waiver. And the second one is about the household that consume about that use about 900 VA, and then they will get the credit like 50% of the discount of the electricity fee. And then the last one is Bantuan Langsung Dana Desa, which is Village Fund Direct Cash Assistant. And then for this aid, the people who got the previous services like Kartu Prakerja, they cannot get this assistant services because this is should be depends on the integrated social welfare data. And then the second one is not getting any aids, like I said before, and then they don't have any job. And then the last requirement or the criteria is the family member who are prone to chronic illness, which is have a heart, the chronic illness. And then it's the benefit is the chief assistant of 600,000 of rupiah each, and then given for 3 months in extent. So for the last measurement is about taxation system, which is this is also really important for the Indonesian government to relocating and then use of the data, use of the money, because the tax system is known as the fiscal welfare, and it's also a major source of social policy funding itself. And then the Indonesian government has taken comprehensive fiscal and monetary policies to deal with the COVID-19 with this system. In the fiscal sector, the government has implemented a social and refocusing activities and budgetary allocation by issuing presidential instruction, which is all of the they are instructed to all of the head of the government, like ministry, governor, region, mayor, or even flag head, village head, to accelerate activity refocusing, budget reallocation, and procurement of goods and services for handling the COVID-19 in the low level. And then for the conclusion and the recommendation by this research, the government is intended to dealing with the COVID outbreak by release a social policy for society, focusing on the vulnerable group in Indonesia. And also it's really important to the government to make a rigid data about the people who can get this aid of this program. So there is no people get double services, and then there is should be classified, which is this is for poor people, and then the rich people cannot get it because they can supply by their own life for their daily life. So it's really important to make a clear data, and then this the involvement of the society in this agenda should be synchronized with the government, because it's helped the government and help the society to work together and then have a better life after this COVID, to overcoming this COVID also. So that's all my presentation. Thank you.
Okay, thank you so much, Mr. Gali, for your presentations, and the programs run quite well and fulfills 3 categories, namely have a social program and taxation systems, and have a direct impact, and also get impact on the welfare of vulnerable communities.
Yes.
It's affected by COVID-19 pandemic. So we are going to the second session. Second session is question and answer. For the first one, for Abhishek Pandey from India, the first questions, only one question. With the lack of agriculture infrastructure and the COVID-19 outbreak, what steps have the Indian government taken to help agriculture in India so that agriculture commodity prices remain stable? Stable so that the income and welfare of farmer will not have a significant impact on a COVID-19 pandemic. The question is from Diana, Diponegoro University. So, Abhishek Pandey.
Yeah, I can hear you. Okay, sir. Okay, I will take this question into 2 parts. I will take this question in 2 parts. How government supported a farmer, especially in this turbulent time. To answer this question, actually, in the beginning of this pandemic, when this initial lockdown phase started, the government gave announcement of 1.7 trillion rupees, Indian rupees, package moves to protect vulnerable section, and immediate release to transfer 2,000 rupees to the bank account of farmer in order to support the farmer, especially in this turbulent time, through PM Kisan scheme. And Indian Council of Agriculture Research issued state-wise guidelines across the 29 states in India for farmers to be followed, especially in this lockdown time. Cash and food assistance to the migrant labor have been announced as a separate PM Care Fund. Now come to the second point of your question, sir. Now regarding the stability of essential commodity. Government of India approves farmer-friendly amendment for essential commodities, and they remove the commodity like cereals, pulses, oil seeds, edibles, oil, onion, and potatoes from the essential commodity in order to support the farmer. And purpose and aim was to remove the fear of private investors of excessive regulatory interferences in their business operation. And especially the first lockdown phase started here in India on 23rd of March, And immediate to the lockdown, face mask and sanitizer were being declared as an essential commodity with effect from 13th of March in order to stop the black market of this particular essential commodity in view of COVID-19 outbreak. And our farmers have a variety of options to choose the market, especially to deal their problem of selling the product. They have given lots of leverage and option to have market where they can sell their product across India, and removing intensive barrier, providing e-trading facility for strengthening the dream of one nation and one market policy. This is what was the government side to make the commodity stable.
Okay.
Thank you, sir.
Thank you so much for the answer, Abhishek Pandey.
Welcome, sir.
And the next question for Dr. Alexander. Are you here, Dr. Alexander? Dr. Alexander, could you hear me?
Yes. Yes.
Okay.
Yes, okay.
Okay.
Yeah.
We're going to read your question for you. And how the strategy central government to prevent declaring formalisms and personal interest. So please take it your time.
Thank you very much, Mr. Rizky Ananda, moderator. The question is about the strategy for formal institution to collaborative arrangement so that the stronger institution or public institution become better, become stronger. I think the most important is take the reality honestly and bring it to the policy. It is the first strategy. And before we reach that point, we have to enable ourselves to be accountable. So accountability, justice, and then the rule of law must be enforced first. So the real common strategy to achieve that point is how to manage the institution based on the rule, and then rule is a matter of how to make it to be the commander. So there is a dichotomy between rule as politic and rule as a commander. So to build the strong institution is we have to put the rule, legal norm to be the primer, the strongest capacity building instrument. So to be that, I think the most important is how to make a commitment together. So as we know that if we talk about the social contract or to be the base of the commitment to build the collaborative governance, it is a matter of how to accommodate the interest of each stakeholders involved. It is very important for us to realize together that democracy, accountability is our priority to achieve. So it is the strategy, how to form the value into our life, not being audible, but the most important is being visible. It is the strategy, Mr. Rizky Ananda.
Okay, thank you so much for the answer, Dr. Alexander. And the next question for Mr. Gali. So far, how effective have Indonesian government policies been in providing social policies in the field? So, could you hear me? Please don't unmute.
Yes, yes. So the question is talking about how effective the strategy runs by the government to prevent the COVID, right?
Yeah.
Yeah. So in my opinion, that it's quite effective because now the government is trying and then struggling to help the society, to help the country, and then to prevent the COVID-19. And then, as we may know, that there is several services program, even law, even the policy itself covering these issues. So for my recommendation for the government, it's like the keynote speaker said about the transparency, accountability, resilience, and then also the collaborative communication between the government and the community should be done, because it is really important to cooperate with the society and also the government to prevent the COVID itself. And then Dr. Ida said that the collaborative issues between the government and the society by using the local language is really effective to tackling the program, to give the awareness of the people itself, and then educate the people itself about the important things to be self-resilience to overcoming the COVID-19. So that's all my my reaction about the question. We should have self-resilience about this issue first, and then we can start it from our family, and then we start to the village level, and then next is the city, province, and also the nation. So it could be cover and then overcoming the virus. Thank you.
Okay, thank you so much for all of presenter about the answer from a question. So to anticipate COVID-19, which has an impact on every community activity, there are many programs and also policies issued by the governments, especially Indian governments, which is trying to boost economy, grow the agriculture sector. And additions, the Indonesian government has also provided many aid programs to revive the economy and rural communities, such as empowering the economy through providing basic food assistance, cash assistance, including village empowerment through village-owned enterprise, and also trade food logistic, which aims to make people to survive conditions of the COVID-19 pandemic. So to revive the economy in rural areas, and we would like to say thank you to all of you. Thanks for coming and joining the seminar, especially for our three presenter. And we would like to say thank you also to all of our participants. Thanks for coming and joining this seminar. And we hope to see you again in the next agenda or the next event. So I would like to say thank you so much anymore, and see you in the next agenda. And thank you so much. Goodbye.